morning, everybody. Welcome to the Senate Budget and Appropriations Committee. This is the fiscal year 2017 public hearing. Our first public hearing of this fiscal year's budget review. Today we are located at Rowan University in the Chamberlain Student Center here in Glassboro, New Jersey. Before we open up, do a quick roll call. Senator Thompson.
Here.
Senator Beck.
Here.
Senator Oro.
Here.
Senator Bucco.
Here.
Senator Stack.
Here.
Senator Greenstein.
Here.
Senator Ruiz, Cunningham, Barnes, Van Drew, and O'Toole are excused. To the folks that are here, this is, I think, my 7th year as the chairman of the Budget Committee. What I'd just like to let everybody know how we work, the public hearings are. We will call 2 or 3 names. The first name will come up to the front of the dais. I'm going to ask 2 other folks to come to the front row so we keep this moving. We'll give everybody 3 minutes. You will hear a little timer go off. That means please begin to wrap up. All of your testimony is being recorded and will be provided in transcripts to the members and also be put on the internet. So please do not read your testimony. You do not have to read. Please summarize. Members will be moving in and out. Our staff is here as well, so please do not believe or think that nobody is paying attention. We do want to hear what you have to share with us. And all of your testimony, as I said, will be recorded, put on the internet. Copies of the transcripts will be provided to our staff. So I don't want anybody to think there's only 1 or 2 members here. Please do not take that as that the Senate Budget Appropriations Committee is not interested. Yeah, please, if you need to make a phone call, this is a beautiful student center. There's a lot of room out there. So if you need to make a phone call, please put all your electronic devices on vibrate or silent. Please go outside and go to the student center, spend some money here at Rowan University, but please, I don't want to disturb those who are testifying and those who are sitting up here to listen. Before we got started, and I apologize for being a few minutes late, various members of our committee had an opportunity to take a wonderful brief tour of this university. And I have not been here in a long time. I came here to play college baseball many years ago in the old Glassboro. It is very exciting. And there are great things happening here at Rowan University. And we're going to hear from 2 men who have really led the way here and have great foresight and great vision and great leadership for this university, which impacts our state as a whole. So we're going to open up today with our great Senate President, Stephen Sweeney, and Dr. Ali Hushman, the President here at Rowan University.
Thank you, Chairman and committee members. And it really is an honor to have everyone here on the Budget Committee because we wanted you to see where some of your money's going and how it's actually working and how we're actually creating a private economic development here. There's hundreds of millions of dollars of private capital being invested in here, expanding capacity to keep more students in New Jersey. Looking at our school now, this is the first school in the state that actually used a public-private for classrooms. You know, we always hear about public-private for dormitories. They're actually using public-private for classroom space. They're thinking outside the box. They have a 3-year degree. If you go to school year-round for 3 years, you get the 4th year free. So you can get, we always talk about higher education, how to do it more affordable. Well, you do it more affordable by having people like Dr. Hushman have some vision. It's so exciting to be able to solve some of the problems that exist in this country, or at least to address them. Again, pay for 3, get 1 free, $25,000, and you get a 4-year degree. Working with the county colleges, 3 for 1, where you go to the county college for 3 years, 1 year here, you get a 4-year degree, and you reduce the cost of graduation rates. What we're doing here should be replicated around the state. And I really truly believe most of our county colleges should partner with an Institute of Higher Learning, whether it's Rowan or Rutgers or NJIT, to start to rebrand our county colleges like we have, which actually basically happened in Pennsylvania with the Penn State model. We lose a lot of kids to other states, a lot of kids after we spend a lot of money on them. And we want to talk about growing an economy. Well, we lose about $7 billion a year with the 30-some thousand kids that leave. You provide the opportunities here. This school is now ranked ahead of Temple nationally. It is now ranked ahead of Drexel in engineering. These are kids that would go to Pennsylvania because it's right over the bridge because they didn't have an option. So what you're seeing here is a rebirth of just not of the school, but of an entire economy in southern New Jersey. This university is the engine of economic development that's going to take southern New Jersey to the next level, which is not that easy to do. So, Chairman, I really do appreciate you coming here and allowing me to say a few words. I'm really proud of this place. It's one of 2 schools in the nation that has an MD and DO program, has top-ranked engineering schools, and is drawing a lot of attention internationally. We even have a fossil park now. So if it's going to make international news, was actually on the front page of the New York Times, a 2-page spread because of all the excitement that's going here. So with that, thank you for being here at Rowan University, and I'm going to turn it over to Dr. Hushman.
Thank you, Senator Sweeney. Good morning or good afternoon, ladies and gentlemen. Chairman Sarlo, a member of the committee, I want to wholeheartedly welcome you to our campus. Thank you for being here. But I also want to thank you tremendously for the investment that you provided to us to do what is really, what I believe in our heart is our public responsibility. To provide highest quality and affordable education to as many citizens of this great state as possible, and in doing so make sure that our community, our surrounding are lifted at the same time, be an economic engine. Therefore, in everything that we do in this university, we focus on 4 fundamental issues that are very important to us. We call them our 4 pillars. Accessibility. We believe every citizen in this great state deserves a baccalaureate degree. The reason is the baccalaureate degree of today is the high school diploma of 20 years ago. If they don't have it, they're not going to have a better quality life. They're not going to be able to go and buy the next house or a car and lift the engine of economy of this country. Therefore, it is incumbent upon us to provide that education to every citizen. And we do that. As a result, over the past 6 years, in our university, we have grown this institution by 6,000 students. We went from over 10,000 to 16,000, our projected to be about 17,000, and our goal is 25,000 by year 2023. In fact, when it comes to a full-time undergraduate, we have already surpassed the year 2022 goal of undergraduate recruitment. That's how many applicants. Our applications are out of control. I can read some of the very quick data because I really don't want to read any testimony in here. 69% increase in total enrollment, 29% in enrollment of underrepresented students, 75-point increase in SAT for regular admit, 87% retention rate, which is amazing, close to 90%, it becomes an elite. In terms of affordability, we had 0 tuition increase in year 2014 and under 2% year 2015 and 2016. And I have made the commitment for as long as I'm the president, the tuition and fees will not increase more than the rate of inflation. And the other commitment that I've made for as long as I'm the president, no matter how much cut we get, the academic affairs of this university will never be cut. We will always hire more and more faculty. So in terms of affordability, we looked at that. In terms of research, we have had 70% increase in projected research expenditure in only 4 years. We have had 69% increase in invention and disclosures. 10 years ago or 6 years ago, we had no patent in here. In a space of 5 years, we have had 10, and there is another 10 that are working. We had no disclosure 6 years ago. Already we have 80 of them. And the beat goes on and on and on, and all of them are summarized in this booklet. There are only charts and graphs, and it shows a snapshot of this university over the past 10 years. I believe that if the university presidents are given the authority, but at the same time held accountable, to be very judicious in the way that they use the public money, to do absolute public-private partnership in everything that we do, except creating knowledge and imparting knowledge. And if you really try to be very frugal and apply the business principle, there really isn't any need for the public institutions to constantly go for a handout and get more money. We need to find ways to create our own revenue. We need to do public-private partnership. We need to do fundraising. You will see in here, we have had 11-fold fundraising, 11-fold increase in fundraising in the space of 4 years. We have to be aggressive. It's our responsibility. We get paid for it. Our job is to provide all the opportunities so that we do not constantly tax the taxpayers and the state of New Jersey for enhancing their education. It's very, very possible. I'll give you one simple example. The Senator mentioned. The 3+1 is a new program that we started in the county colleges. The students take the first 3 years of the courses from the county college. When we take our third curriculum that belongs to us, we loan it to them, and we approve who teaches it, we approve what the content is, they deliver it at the county college cost at $100 per credit. And in the 4th year, they just cover it, pay our tuition. The total cost of this degree is under $25,000. Now imagine this as a possibility. Suppose that we get these students and every one of them is sponsored by a company in New Jersey, and that company pays only $7,000 to this student, and the student in return works for 500 hours per year, average of 10 hours per week. And if the state is allowed to make that income non-taxable, and the feds the same, we can use that money to pay for the entire tuition and fee and room, books of those students, and they can get 4-year degree for 0 cost and 2,000 hours of internship under their belt. Imagine that as a possibility of workforce development. We can do that today in this state. It requires partnership. That's what I mean by higher education needs to partner with the local government, state government, businesses, as well as the academic. We cannot do it ourselves, and we shouldn't do it ourselves. I hope that you will help me spread this word and make our state a great state when it comes to higher education. Thank you.
Thank you, Dr. Hushman, and I'm sure your passion, you could speak all day off the cuff and just keep going and going, but I will say this to you, Dr. Hushman. We met a few years back here at a budget committee, and we were kind of going back and forth on the future of Rowan University with regards to the merger, higher education merger, and a medical school, and you made a lot of commitments that day, and I will tell you this, we are so proud of the work that you have done. You've made us all proud, and if there was any doubts, you proved them wrong, and your leadership and your creativity here is really a godsend for this region of the state. So I know we had a tour. We were impressed. The other members who did not have a chance to get on, please, if you are interested, they'll provide that tour for you. And thank you. Thank you to Senate President. Thank you, President Hushman. And thank you for having us today.
Thank you.
Senator Bucco, before we begin, would you like just to, a few remarks?
No, thank you, Mr. Chairman. I just wanted to thank the doctor also for the tour of the facility. I haven't been to Glassboro College for a long time, and was quite impressed with Rowan University. So I congratulate you and look forward to coming back to see the improvements again in a few years. Thank you.
Okay, we will begin. There is a traffic light over here. Green means you're on, yellow means wrap up, red means it's time to go to the Student Center Cafe. No, I'm only kidding. Again, also the members here, we typically do not interact a lot because this is a learning session. And as I said, all the testimony is being recorded. So please don't take that we're not interested, that there's not a lot of interaction and not a lot of questions. You have a lot of veteran members who've been doing this a long time on this budget committee. So please, we understand and we respect your input. Okay, our first person up will be Joyce Campbell, Catholic Charities, the Diocese of Trenton, up first. Number 2 will be Marie Blisserton, NJEA, if you can make your way to the front row, followed by Thomas Bafuto, Executive Director of the ARC of New Jersey. You are third up.
Good morning.
Good morning.
Thank you for the opportunity to hear testimony from Catholic Charities, Diocese of Trenton again. We've been serving the state for over 100 years for those impacted by trauma and adversity to renew their lives, but more importantly, to restore their hope. We feel that hope starts with us. I'd like to share with you the view that we have of the proposed fiscal year 17 budget. We certainly see and applaud the dedication of funding to mental health and substance abuse services and the integration with primary health care services. We know that those investments are going to help us to continue to provide compassionate quality care. The proposed $127 million to increase rates under fee-for-service is a sound investment to a crumbling social service system. think you're all well aware that we have not received cost of living adjustments over many years, which has really made it very difficult for us to continue to serve the people who come to our doors. So we ask that you ensure these funds remain in the budget, but also consider a 5% COLA for contracts that will remain outside of the fee-for-service system. We're dedicated to making the transition to fee-for-service work. However, we want to make sure that we have the appropriate resources in this budget and beyond so we can provide quality care for wellness and recovery. What we also see is a shredding safety net for the most vulnerable in our state. We ask for support of state policies that would assist those living in poverty, the aged and disabled, and victims of domestic violence. Anti-poverty advocates like myself have been very encouraged by Speaker Prieto and Senate President Sweeney's recent efforts to introduce and pass a package of bills to address these needs. Specifically, I call to your attention the State Rental Assistance Program, which this year is flat funded despite the need for growing rental vouchers. We would like to see the program funded at the fiscal year 11 level without using funds from the Affordable Housing Trust Fund. Attention needs to be paid to the major decrease in the granting of emergency assistance for recipients of Workforce New Jersey. The elimination of extended EA benefits for the most disabled since last July has caused great stress and homelessness in some instances. The additional enforcement and narrow interpretations of eligibility for EA benefits overall is contributing to unnecessary homelessness and the closure of shelters across our state. Social services the homeless is also flat funded, putting those at risk of homelessness. Workforce New Jersey benefits have not been increased in 29 years. This has certainly increased the depth of child poverty in the state. And also we've seen, and you've heard about changes in the Supplemental Nutrition Assistance Program. We ask that all of these be given consideration. But lastly, we ask that the $2.4 million that was in the last two budgets for domestic violence and sexual assault be included once again. The additional funding in the last 2 years allowed our Providence House domestic violence program to maintain staffing levels and gives long overdue increases to some of the staff. This funding supports life-saving services. Not only does it keep women and children out of danger, it keeps them alive. So thank you, and we remain as a resource to help you in ensuring that the next budget is adjusted for cash and money.
Thank you, Joyce, and thank you for the work of Catholic Charities, and your requests have always been reasonable over the years. Thank you.
Thank you.
Should I stay here?
Move over to the middle. It's better for the picture. Okay.
Turn this.
Yep, we're good to
Hi,
go.
everyone. I'm very happy to be here. For those of you who don't know, especially from the north, this is my home county. I live here and I work here. I'm a teacher here. My name is Marie Bliston. I've been a 30-year classroom teacher right here in Washington Township. And as I said, I live over here in a little town called Harrisonville. But I am also here because I am the proud vice president of the New Jersey Education Association, representing over 200,000 school employees. And I am here to testify about the budget that the governor has proposed. So I want to say this at first. You have my written testimony. I'm not going to read it. I will only highlight a couple places. But I want to lay this as the groundwork. Our public schools in this state, over my 30-year career, have catapulted to the top in this nation in all areas. That has happened for a number of reasons. Number one word is people. The staff, the quality staff that we have hired in our public schools, the 200,000 public school employees who are our members at NJEA, and we advocate for that, as you well know. Second group of people are parents and community members who know the value and the worth of public education for our children and also for real estate. And then the third group of people has always been the elected officials, because we are dependent on public monies. We are dependent on you to prioritize priorities such as children and public education in the form of money and resources. And quite frankly, when I saw that budget, and I was in the State House that day, I was more than disappointed. I was actually alarmed, because I see what it is doing to public education over the long haul. So I can mention that you will see testimony regarding our pensions, regarding Chapter 78's consequences and position on us, and also, of course, of the state aid monies and how the governor is proposing to distribute that money. Speaking of the pensions, you well know that we are $1.86 billion short of what the legislature and the governor had promised when imposing Chapter 78 back in 2011, and that represents the fourth consecutive year. We also know that it is further evidence of why we are going to continue to ask for your help to get a constitutional amendment in place so that we can finally fix that loophole, finally do responsible payments into that pension and stabilize it. We also know that the governor has proposed that making a pension payment contingent on a savings of $250 million in additional public employee health benefits costs. But we know that the state has already realized over $200 million in savings through plan design changes. And our members, through the unintended, I think, consequences of Chapter 78, have been suffering lower and lower salaries over the last 5 years. In fact, we have included testimony from one of our school counselors on your second and third page, and she is a single mother, and basically she is reporting that over the last 5 years, her check has continued to reduce, and she is struggling to make ends meet. We kid you not when we say we have members who are losing their homes to foreclosure because of the way this is set up. And I worry about that. I worry about maintaining and attracting more people into this profession, especially as we have our baby boomers leaving. We also know that on the state aid, that although the governor has proposed a 1% increase, we see that $32 million of that will go to Atlantic City because of the loss of the casinos. We see that $26 million will fund charter school operators, again though draining money from our traditional public schools. In fact, the charter operators in Newark alone will get 85% or $22 million of that money. We also know that he has proposed another $1 million for the Opportunity Scholarship Act, which is completely taking public money and putting it into private resources instead of investing it where we know that we can most use it.
I'm going to need you to begin to wrap up.
I'm going to wrap up right now.
Thank you.
Thank you for your time and your consideration, and we remain open to meeting with any of you to answer any further questions. Thank you.
It's good to be in South Jersey.
Yes, ditto.
Okay, Thomas Bafuto, Executive Director, ARC of New Jersey, followed by, will be on deck, will be Deborah Wentz, New Jersey Association of Mental Health, followed by Tom Bruno from New Jersey PERS, followed by John Indike from Healthcare Association of New Jersey. So if you other folks who I just called, if you get here in the front row, it would be great.
Good morning. Thank you, Senator Salo, members of the committee for this hearing today. I'm Tom Bafuto, Executive Director of the ARC of New Jersey. The ARC is about people with intellectual and developmental disabilities and their families. Yesterday, many of you greeted our self-advocates in the State House, and they really appreciate you stopping by. Today, I have with me Bob Page, a family member, and the president of our board to deliver our testimony.
Good morning, and thank
And great turnout yesterday, Tom, in the State House. It was a great presence by many of our constituents and some of our most vulnerable folks in our population, so great turnout.
Good morning, and thank you, Senator Sarlo and members of the committee, for the opportunity to testify here today. My name is Bob Page, and I'm president of the ARC of New Jersey, and the father to Annika, a young woman with significant medical and developmental disabilities. Although I stand here today as one person, please know that I represent thousands of families caring for children with intellectual and developmental disabilities across the state. While I have spoken to many parents in my capacity as president of the ARC of New Jersey, I have also spoken to them as a fellow parent. This funding has a significant impact on their lives and the lives of their loved ones with disabilities, just as it does on my family and my little girl. On behalf of all the families caring for loved ones with special needs and supports, please know that we appreciate what you do here, and we understand the hard decisions that you make each year to keep our state moving forward. There are so many priorities in New Jersey, and so I want to take this moment on behalf of mothers and fathers, siblings, grandparents, and extended family members to thank this committee and you for your continued dedication to individuals with intellectual and developmental disabilities. Please know they are grateful, and I am grateful. The proposed fiscal year 2017 budget provides funding to many significant areas of concerns for families and is a true investment in community living for individuals with IDD. As a father, I can attest that the community waiting list and the need for housing are two budget items that weigh heavily on families' minds. Thankfully, the proposed budget includes increases to money to move people up the community waiting list and into services, as well as 500 new housing vouchers for individuals who can live independently, but with proper supports. Furthermore, there is increased funding to assist students transitioning out of their educational entitlements and moving into the adult program systems. These former students will be able to participate in day programs or find employment in their communities instead of suffering from isolation in their home where school is no longer an option. There is also funding to help individuals and families in crisis, as well as money to assist community providers as they move forward to face the new fee-for-service system. For children under the age of 21, funding for family supports in the current fiscal year will stay unchanged in fiscal year 17, and there is increased monies to support the child as well. The one area I would like to address is the direct support professionals who deliver the one-on-one care to people with IDD. The starting salary is barely $10 an hour, and they are asked to do tremendously important work. The ARC has long advocated for higher levels of funding in order to pay adequate wages, and we urge you to take action to address this very important issue. In closing, I can speak firsthand as a caregiver about the importance of funding of the proposed budget. While the uninformed may view these as merely line items in a massive budget, I will tell you that the money makes real difference in real people's lives. With that in mind, I ask you please to keep all the proposed fundings intact. Doing so will allow my daughter Annika to live an integrated life in the community. For her, that means friends, families, a connection to our church, and plans for her future as an adult. Thank you all so very much for all you do.
Thank you for your advocacy for your daughter and for the ARC. Thank you. Dr. Deborah Wentz, President and CEO of the New Jersey Association of Mental Health. On deck will be Tom Bruno, followed by John Indeck.
Is it on or off with the red button?
You're on. You are live.
Thank you. Okay. Well, good morning, Chairman Sarlo and members of the Senate Budget and Appropriations Committee. As you know, I represent New Jersey Association of Mental Health and Addiction Agencies, 160 organizational members who provide treatment and support to more than 500,000 of New Jersey's children and adults with mental health and substance use disorders annually. I ask you to extend every possible support to the community-based behavioral health care system as it transitions to the fee-for-service model. This system has sustained years of inadequate funding, inadequate rates, and a lack of cost of living adjustments since 2008. The Community Provider Network provides a lifeline to families struggling with mental illness and addictions, to homeless veterans, and to children with serious emotional disturbances. We ask you to not only support the $127 million lifeline that Governor Christie has proposed, but also to provide other supports that will ensure that there is a solid, viable lifeboat at the end of the road. Specifically, we ask that you ensure that there is funding to support adequate rates, including an annual inflationary factor that cover the full costs of providing services and operating providers' businesses, beginning with maintaining the proposed $127 million. An investment of this magnitude is long overdue and much needed. However, this investment alone will not ensure the viability of many providers. Second, we ask that you preserve the savings that have been realized from Medicaid expansion in the community-based system of care. This investment is necessary to meet the high level of unmet need. Increased capacity will improve access to care by shortening wait times and reducing emergency room visits and hospitalizations. Third, we ask that you provide a 5% COLA for all contracts that will remain in place after the transition to fee-for-service takes place. For decades, providers have not been able to provide any salary increases to their staff, and that causes an ever-widening gap between the salaries providers are able to pay and those who are at state and educational institutions. This causes attrition that disrupts individuals' progress toward recovery. Your support is needed for the community-based providers. It's through your support that the community-based system of care will be able to remain viable and serve as a true lifeline to New Jersey citizens through timely, quality care, and we appreciate that support. Thank you.
Thank you. Tom Bruno, Chair of New Jersey Public Employees Retirement System, followed by John Indike, followed by Megan Anderson. You'll be up third. Is Megan here? Very good. Hi, Tom. Good morning.
Hi, Chair. Good morning, Chair, Vice Chair, members of the committee. Although I chair the New Jersey Public Employees Retirement System Board of Trustees, my comments today are my own. They're not in that capacity, but as a plan participant and a retired state worker. I have some grave concerns about what's going on with our developmental centers and the Division of Developmental Disabilities. The details are in my written testimony. I won't go over them here, but I think it's important that you take a look at what I've written there because it is alarming. Next, I come to you with concerns about the public employee retirement system. In 2010 and 11, you passed legislation which effectively diminished employee retirement benefits by 37% in an effort to save the pension. And in so doing, you brought the pension down to a ranking of 95 out of the top 100 pensions in the U.S. in terms of benefits. You then increased the employee contributions to 7.5% on a staggered scale. And you may recall that the rate was just 3% a scant 12 years ago. The idea behind the increased contribution was that workers would pay down the unfunded liability that they did not cause, but threatened the fund's integrity. But that's not what happened. Instead, this governor has used that increase to pay his normal operating costs for the pension, the normal cost payment. So the unfunded liability continues to grow. And with it, the cacophony of noise emanating from the governor about needing further sacrifice from the employees and retirees while he claims the clown car that public workers are forced into is the Cadillac pension that he has. As part of the deal in 2010-11, we were told by this governor and this body that the payments would be made. They have not been made. Not for 3 years, and now with this budget it'll be 4. And like those evaporating funds, so too has New Jersey's credit rating evaporated, a total of 9 downgrades. Employers are being asked again to pay more to get less, and the governor's campaign donors, though, appear to be doing quite well with our money. Although we can't tell for sure because the Board of Trustees for the funds have been told that while they have the fiduciary responsibility to protect the members' money, they have no legal authority to do so, at least according to the governor's appointed attorney general. The boards purportedly cannot demand an audit or a cost-to-benefit analysis of the enormous management fees that we're paying for questionable results in our alternative portfolio. To put it into perspective, we have an $80 billion fund. Roughly 26% of that fund assets are in alternatives, such as hedge funds. More than $700 million a year go to private management companies to manage those funds, 26%. Conversely, the 74% that we have in regular stocks and whatever, the public entities, it costs us $10.1 million to do that, the remaining 74%. If that doesn't scream audit to you, I don't know what does. I really don't, because that is ultimately an outrageous amount of money that is actually half of a pension payment that we're sending out for private equity companies to manage our funds. It's absolutely absurd. So the elected trustees for the funds need statutory authority to act in a manner that matches their legal responsibility to act as the plan participants' fiduciaries, such as determining, commissioning, and directing payment for an independent forensic audit when deemed necessary. And finally, as plan participants, we don't need more draconian reductions in benefits to retirees who gave their youth in selfless service to the citizens of this state and never missed a payment to the pension system. We just need the governor to pay the damn bill. Thank you. Thank you.
Chairman
John,
Solo,
it wouldn't be a public hearing, budget hearing without hearing from you. so-
I'm used to this, unfortunately. Thank you, Chairman Sarlo, members of the Senate Budget and Appropriations Committee. My name is Johnny Knight, Vice President of the Healthcare Association of New Jersey. We represent approximately 300 long-term facilities throughout New Jersey. First, I want to thank you all for your bipartisan support of past increases for nursing home and assisted living funding increases. Unfortunately, the increases did not make up for more significant cuts in previous budgets. And I'm sad to report that today, our daily shortfall in what it costs to take care of Medicaid beneficiaries in nursing homes, what we're reimbursed is now $35, in excess of $35. That's a $5 increase from the previous year. We just can't keep up with the rising costs given the reimbursement we're getting. The governor's projected that there would be 28,500 average monthly census of nursing home patients in facilities. If you look at the $35 plus shortfall, that means we'll be losing $367 million a year, this in fiscal year 2017, for caring for Medicaid beneficiaries. That's a $50 million increase over the previous budget. How can nursing homes be expected to continue to provide quality care for increasingly sicker Medicaid beneficiaries amidst a reimbursement shortfall that has grown by more than $50 million in the past year, and now a state budget proposal that calls for flat funding? In fact, 48% of all nursing facilities now receive rates that are less than what they received in fiscal year 2008. Of those that did receive rate increases over the past 9 budgets, the increases totaled an average of only $2.37. That is less than what costs have gone up in this past year alone. Much of the reimbursement shortfall can be attributed to past cuts in budgets for nursing homes. I'm not going to go over the entire list, but I'll just give you a sampling. The budgets that eliminated the bed hold and therapeutic leave reimbursement, eliminated inflation adjustment, eliminated rebasing of rates, implemented a budget adjustment factor that cut rates, and they cut allowable costs for which we can reimburse. Because of these cuts were carried over from one budget year to the next, the cumulative effect since we implemented provider tax to support our rates in 2005 is $1.35 billion. Add to that $57 million of provider tax collections that go from nursing homes to the general fund. It's more than $2 billion that we did not have available to take care of sick, frail Medicaid beneficiaries. Last year we asked for about $21 million on state funding. We received 5.25. In light of the increase in the shortfall this year, we're again going to ask for another $21 million. We appreciate the fiscal times. That's half of what our shortfall increased by, more than half. And we bring our daily shortfall down to about $31 a day from the 35. In addition, our assisted living providers are also facing tough fiscal times. And last year we requested a $2.50 per day increase for each Medicaid beneficiary. We received 63 cents. So what we're asking again this year is that we bring that up to what we requested last year, $75 per day increase for assisted living providers. That would cost the state about $1 million. And I'm done. Thank you very much.
And John, I think you know, both in a bipartisan manner, Republicans and Democrats, on an annual basis, on a yearly basis, we have always worked as part of, and this year we're hoping it to be a negotiated budget. We've always worked to be able to restore some of the cuts.
We appreciate all of your support and being there for us in the past. Thank you.
Megan Anderson, New Jersey Alliance for Children, Youth, and Families. Jeff Tittle here. Okay. Josh Brzezinski will be followed by Josh Brzezinski and Susan Caldwell. If the two of you could make it to the front, we appreciate it.
Good morning, Chairman Sarlo, Vice Chairman Staff, and members of the Senate Budget and Appropriations Committee. My name is Megan Anderson Fisher. I'm the Executive Director of the New Jersey Alliance for Children, Youth, and Families. For those of you who are not familiar with the Alliance, we're an advocacy organization representing human service agencies throughout New Jersey. Our members provide services to children and adolescents experiencing emotional and behavioral health challenges, children living with developmental and intellectual disabilities, youth who have experienced physical or sexual abuse and neglect, homeless youth, pregnant and parenting young adults, victims of human trafficking, youth experiencing substance abuse addiction, and youth in need of independent living skills and housing. I know that we've heard from several individuals today who have talked about a cost of living adjustment, and that is what I'm here to talk about as well. I have testified many times, and I just want to share, because in my written testimony is, all of the discussions that we've put forward over the years, but I just want to share something personally, because the words on the paper that I've read and that I've lived have become real to me, and so I want to share exactly what this means. And so we talk about the salaries of direct care staff and the impact that that has, for each youth that's served by our organizations. And over the past couple of years, my own son has come to need the services that were provided by our organizations. And I can tell you the individual who changed his life and changed our lives and made sure that he's still in our lives. And so, I'm going to continue to kind of go over what our argument is, but to kind of put it into perspective the way that it has for me over the past couple of years is that individuals, like the gentleman from the ARC testified, that some staff members only make $10 an hour. And so those individuals are the ones making the real differences in lives. We have very talented CEOs and supervisory level individuals making sure that the organizations are running, doing an excellent job providing the care that they need. We have partnerships with the department to make sure that all the practices are, we're leaders in the nation in New Jersey as far as providing behavioral health services to developmental and intellectual disabilities. But it's these direct care staff who are with each of the young people on a daily basis, and they're the ones who, because of the way that the system is set up, we can't just, increase what we charge for services. It doesn't work that way. Organizations are paid a rate, and they must stick within that rate, and they can't just decide to give everyone a salary increase. That's where we need your help. And so I would just say that if you have not had an opportunity to visit one of these organizations, my contact information is in my testimony. Please reach out to me, and I will make sure that you get connected and that you meet these individuals who are really, providing this care on a daily basis and who deserve a cost of living adjustment. So thank you.
Thank you. Susan? Susan Caldwell? Who did I call, Josh? Susan Caldwell, come on. No Susan Caldwell? Okay. Josh Brzezinski? And Megan Anderson, I'm sorry. Megan Anderson just went, okay. Josh is here. Susan Caldwell? No? Okay. Joan Migden. Wow. Thank you. Sorry for the confusion.
Good morning, Mr. Chairman and members of the committee. I'm Josh Brzezinski. Although I'm listed as a citizen here on the paper, I'm really representing I am a citizen of the state.
Thanks for clarifying, Josh.
Central Jersey.
You're a good man.
Yeah, thank you. It was a pleasure coming down here. But I'm also the New Jersey director of the Orthodox Union Advocacy Center, and I'm representing them in my testimony today. I don't have to read my testimony to you. You can see it's probably the same as every year with some slight modifications. As you know, the non-public school students in the state of New Jersey comprise 10% of the student population, yet are receiving less than 1/2% of the educational funding in the state of New Jersey. I understand this year's budget, in which we will be against the governor's proposed budget, does add money in the educational line, as you can see on the budget detail list, for every line item except for those for non-public education, which has been decreased by $6 million. And although we know every year there's a give and take between the legislature and the governor's office regarding the fundings for technology and nursing aid and textbook aid, and hopefully, like every year in the past, we will see it fixed on a bipartisan basis by June 30th. There is one line that we are appalled at in this year's budget, and that is security. Last year, for the first time, the state of New Jersey provided security for the 150,000 non-public school students in the state. That's 9.9% of the student population. That money was not only reduced, it was eliminated from the budget, which means the governor's office in their proposed budget has removed security aid for 150,000 students. Now, I look at the world situation right now, And I don't see the situation this year being any better than last year. I don't see schools being less of a security to schools being less of a threat this year versus last year. And how anyone could reduce that, not only reduce it, but eliminate it, provide zero security for 150,000 children is beyond me. So yes, we are a little upset about this year's budget. I understand the usual give and take, but this is beyond the pale. And I'm asking the members of this committee to make sure that that funding is restored for these students. Not only restored, but it should be increased, because the average security aid for a New Jersey student is $144. Last year we were privileged to get $25 for the first time in state history. I don't think there should be a difference between children when it comes to security between the kid that goes to this school building and the child that goes to that school building. It should be the same for each child, $144. So we're asking you, the Budget Committee, the Senate Budget Committee, who has always been friendly and understanding of our situation, to again, and Chairman Sharlow, I believe you were involved with this in the past, to make sure that this is restored. As far as the rest of the budget is concerned, you see what we want. We want to see last year's numbers restored, and we also have budget language that I've been bringing to you every year. This year, that needs to be fixed. This year, I was kind enough to add this paper from the budget, which underlines what language needs to be changed for your convenience, and we hope that you will do so. Thank you very much for this opportunity.
And Josh, again, in a bipartisan manner, we have, I'm not sure why the governor didn't include it in the initial budget. I'm not sure, I can't speak for that, but we have in the past negotiated to put some of that language back in for busing, security, technology, and like, you know that members both sides up here.
Right, and look forward to that again.
Thank you.
Thank you very much. Thank you.
We're like a big happy family up here. Joan Migden, citizen. Is Raymond Castro here? New Jersey Policy Perspective. Is Daniel Steinmetz here? Here. Please come up forward. Ron Brady. You're up third, sir.
Good morning. Can you hear
Good
me?
morning.
Okay, can you hear me?
Yes, we can.
Okay. My name is Joan Mason. I'm the parent of a 32-year-old daughter who lives with the challenges of autism and other medical issues. This is the 5th time I have testified before your committee, so many of you know my story. However, our family's path took a tragic turn this past November when my husband passed away very suddenly. He was 62 years old. He had no history of heart conditions. In fact, 3 weeks before his annual physical, his electrocardiogram, his blood pressure, and his cholesterol were all fine. He was so physically fit that he wore the same size clothes as he did when we were married 35 years ago. I certainly couldn't say that. There are 30,000 adults with developmental disabilities living in the state of New Jersey, and the majority of them are living at home with aging parents. If my husband was Barbara's only living parent, she would have been taken to any available group home and would have to deal with losing her dad as well as losing all of her familiar surroundings at once. 20,000 families live with this thought daily. Even if we take care of our health, as my husband did, we cannot predict or plan for sudden tragedies. That is why funding for the Division of Developmental Disabilities is so important. Currently, when the youngest parent turns 55, the son or daughter is placed on a waiting list for community care waiver services. The waiting list has thousands of people on it. My daughter is currently number 1,657, and she has been on that list for nearly 7 years. This is something that you, as a committee, can help to address. I'm asking that you maintain the budget lines that Governor Christie has put in the budget for the Division of Developmental Disabilities, as these increases over last year's budget will help to provide more services for people and decrease the anxiety for families who have individuals that they love on that waiting list. The funding will provide for those who have been on the waiting list for years and help them to transition to a new phase in their lives while their parents are still alive. In addition, the disability community is also staring at a crisis in the pool of direct support workers caused by the low pay for these important jobs. The legislature should examine the rates which DDD is using to pay direct support workers and create legislation that would increase these rates. Funding is also necessary to adequately train direct support workers, who are often dealing with individuals with intense medical needs and behavioral issues. Funding for services and for housing, which has been provided in the governor's budget, will mean nothing if there are no workers to take those positions and provide the necessary care for our most vulnerable population. Thank you for this opportunity to address the committee this morning and for all you do for the residents of New Jersey.
Thank you, Joan. I know you've been here before. Thank you. Castro, Raymond Castro, New Jersey Policy Perspective. Followed by Daniel Steinmetz, citizen, followed by Ron Brady.
Thank you very much. We are concerned with two major issues here, the repeal of the estate tax and the erosion of the Workforce New Jersey grant for children, both of which we believe will increase income inequality in the state. We strongly recommend the state halt efforts to repeal the estate tax given the enormous obligations on the table. Proponents of repealing the estate tax insist that it would pay for itself because it would attract and retain wealthy families who would otherwise avoid or leave New Jersey. They point to a deeply flawed study that claims New Jersey has lost more than 2 million people over the past decade, taking $18 billion in state income with them, apparently in protest of the state's high taxes. Yet a more comprehensive analysis of the data clearly demonstrates that the New Jersey population has remained stable and that the state income tax has actually grown by $1.3 billion in the past decade. Putting aside the tax migration debate, the fact remains the state has always helped, not hurt, New Jersey. The state is adding, not losing wealthy families, and the revenue collected from this and the inheritance tax is growing, not shrinking. In fact, the proposed 2017 budget expects to collect $848 million from the inheritance and state taxes, the highest amount ever. A tax benefit that benefits just a wealthy few is glaringly out of step with the budget priorities of New Jersey, will make it harder to restore earlier funding, and will make it nearly impossible to do much to tackle some of the state's other big problems like growing poverty. To address the alarming increase in extreme child poverty in Jersey, we are recommending additional funding to increase the Workforce New Jersey grant, which would directly benefit 54,000 children. As you may be aware, we recently released our comprehensive report on this issue, and the findings were startling. We should all be embarrassed that these grants have not been increased in 29 years, and we are now have the 10th lowest grant in the nation when housing is factored in. New Jersey has the lowest grant in the Northeast and almost half of New York's. Because the eroding effect of inflation, the maximum value of the grant, which is $424 for a family of 3, has been cut in half since the last increase in 1987. It has gone from 61% of the poverty level to only 25% of the poverty level today. New Jersey spends about $360 million less today on workforce to a family than we did in 1997. Since eligibility is based on the grant, far fewer children are eligible for any assistance. Whereas in the past, most poor people received help, today over 80% do not receive any assistance at all in our state who are in poverty. I have a county breakout on our website. Unless something is done soon, New Jersey, Workforce New Jersey will cease to be a viable safety net for children. Giving all children a shot at success is not only the right moral choice, it's a much better investment. The newest research is that poverty costs New Jersey $13 billion each year in reduced productivity, increased crime, and poor health outcomes. There is no question that Workforce New Jersey is woefully inadequate, even by the state's own standard. Since 2003, the Department of Youth has established a standard of decency that takes into account real needs of the family, including the cost of housing. That standard is now $2,700 for a family of 3, 7 times higher than the current Workforce New Jersey grant.
Good morning, members of the committee. My name is Daniel Steinmetz. I live in Gloucester Township, New Jersey. I'm here to speak with you this morning about a crisis in New Jersey with non-public school busing, the aid in lieu of transportation, an amount that has been set by the state at $884 since 2008 and not increased at all. I have children in Catholic school in this state. Last August, regarding 3 of them, my daughter and her husband got a letter from the Gloucester Township School Board that they've been unable to find a busing company willing to take the students at the $884 rate. There was a month of great consternation at the school and difficulty over this. Finally, the school on its own found a contract around Labor Day with a busing company willing to take the students, but not at $884. The school had to supplement that with its own money, adding to financial stress at the school. I've since checked with the administrators of 5 Catholic schools in our area, and they all tell the same kind of story. In fact, they've all lost certain sending districts for their school because they can't get busing. At the current rate of $884, the busing company just won't bid on it at that rate. Now, I need to tell you that the non-public school system in this state is very valuable to the state of New Jersey. It saves the state a tremendous amount of money. Because Catholic schools alone save $1.2 billion a year in state expenditures for education. So whatever the state spends on busing children to non-public schools is a very wise investment. The effect of having no busing suddenly arise at a non-public school is two things. The school loses students because parents decide they can't send their children to that school anymore if there's not going to be a bus. And also you have parents who are contemplating sending students to the school and decide against it when they hear there's no busing. Now, this can cause the collapse of non-public schools in New Jersey. The Catholic schools in this state are generally very stressed financially. And if they lose students because there's suddenly no busing, that can be enough to close the school. Where those students go, they go to public school, raising local property taxes. And there could be a tremendous increase in local properties in this state if this trend continues. This was all supposed to be solved many years ago by NJSA 18A:39-1A, which has a formula in it saying that it's $884 as of 2008, but to be adjusted every year in accordance with inflation. The state has not been doing that. To my written testimony, I've attached a chart with my calculations showing that the amount at this point, if the statute was honored and was followed, would be $985.68 a student, less than $100 above what it was in 2008. I respectfully urge you to raise this to the $985.68 as a very wise investment to keep these Catholic schools open and save the state a ton of money in local property taxes. Thank you very much.
Thank you. Ron Brady, Freedom Prep Charter School. Is Kathleen Davis here? Yes. All right, Kathleen, you're up next. Is Judy Savage? There's Judy. You're up second. And Randy Thompson, you're up third, sir.
Chairman Sarlo, and other esteemed members of the committee. My name is Ron Brady, and I'm the Regional Director of Freedom Prep Charter School in Camden. I'm also a board member of the New Jersey Charter School Association, and for 19 of the past 24 years, I worked in New Jersey public education. I'm also a parent, along with my wife, of 7 teenagers and young adults, 3 of whom are currently students in New Jersey's charter schools. Simply put, I eat my own cooking. 16% of Freedom Prep's scholars have disabilities, 5% are English language learners, 87% receive free lunch, 6% reduced price lunch. We are, in all respects, a New Jersey urban public school, serving a wide spectrum of Camden students with all of their aspirations and ambitions and all of their challenges and needs. Our mission is to prepare these scholars for college and a life of active citizenship. With the governor's proposed budget, our scholars would see flat per pupil funding. Our program is very straightforward. It's not easy, but it's simple. We identify what students need to learn, we teach it effectively, we determine what was learned and what was not, and then we go about reteaching and retesting to make sure that our students are mastering these important skills. In the current New Jersey fiscal climate, we are now, as we have always done, making the best with the resources that we have. We appreciate the appropriation at the flat per pupil level. This said, were we to have more resources, how would we use them? In 2 different key ways. One, we would hire more teachers. Our children have significant instructional needs, and we would simply hire more teachers to better meet those needs. And 2, we would hire more support personnel. Given their background, our students have very significant social emotional needs, and with more resources, we would hire more professionals to help better meet those needs. In the absence of these additional funds, at the present time, our staff is doing more with less. In a survey we conducted with our teachers earlier this school year, they estimated that they work approximately 62 hours a week in service of our children. Across 5 days, that would be 12.5-hour days. Across 6 days of the week, that would be 10 1/3 hour days. Our teachers demonstrate an indefatigable level of commitment, dedication, and professionalism, and we greatly appreciate this. At the same time, with more resources, instead of doing more with less, we would do more with more. To conclude, we recognize and respect the current fiscal situation in the state of New Jersey. We must also advocate for our children and all public school children in the long run, and so that we hope that this committee can support us in advocating and increasing funding over the long run.
Ron, I will tell you this. When I first came into the legislature, I was suspect of charter schools. I was just talking to Senator Buchel about this. And I still believe in certain public school areas where we're in suburban areas, perhaps charter schools don't fit. But I will tell you, what you're doing and what many of the charter schools are doing in some of the urban centers is great work. And keep up the good work, because you know, as I've evolved in this legislature, I see what you're doing in Camden and what they're doing in Newark and other urban areas. So keep up the good work.
Thank you, Senator.
Kathleen Davis, followed by Judy Savage, followed by Randy Thompson. Is Susan Delaney here? All right, Susan, you're up fourth. Thank you.
Good afternoon, Chairman Sarlo and honorable members of the committee. Thank you for holding the hearing here in southern New Jersey. It's nice to only have a 20-minute drive to testify on issues. Overall, our chamber supports the budget, which for the 7th consecutive year restrains spending and contains no new or increased taxes. And having a state government that lives within its means is really important to the business community. It is important to note that 3/4 of the increased spending in this budget is attributable to funding employee pension and health benefits costs. We applaud and supported past reforms enacted by the legislature and the governor, but more needs to be done. In this budget, the governor references reforms that would generate an additional $250 million in savings that can be realized through more changes in public employee health care plan designs. And reforms outlined in the New Jersey Pension and Health Benefits Study Commission's report also deserve serious consideration. As we've done in the past with our testimony, I'd like to offer the committee members insight into our South Jersey regional economy through the eyes of our members. First, you've heard my president, Deb DiLorenzo, testify on the impacts competition by out-of-state gaming has had on not only our casinos, but our regional economy. And signs of caution remain in this area of the state. I've attached two of the last quarter reports of the Federal Reserve Bank of Philadelphia, a survey that they do of our members. And these last two quarters reflect flat employment, modest growth in sales, and tepid employment projections. We also survey our members every year, and I just want to share with you really quickly some of what they are saying. Our members identified overregulation by federal and state government tied as the #1 issue that they face in running their business, followed by health insurance costs and business taxes. As for the most important issues facing our state, our members rank the business climate as #1, followed by the state budget, state spending, with the third most important issue being the state's taxation structure. And that's why our state's rank at the bottom of the tax foundation's business tax climate is something that our policymakers need to consider within the broader conversation of the cost of doing business in our state. New Jersey is home to close to 600,000 small businesses that employ 5.5 million people and generate $179 billion in payroll. And so the Small Business and Entrepreneurship Council's ranking of New Jersey, again second to the last, is of great concern. Technological advances are making location less important and giving businesses more mobility. We know that the threat of businesses leaving the state for more tax and operational friendly environments is real. It's a quiet exodus, one that's driven by dollars and cents, bottom lines, and a weariness of proposals that make operating in our state more difficult and less inviting. We commend the governor for once again presenting a solid budget that does not increase taxes or fees, and that's important to the job creators of our state who face increasing uncertainty with looming legislation that will increase the cost of doing business. Thank you for the opportunity.
Thank you, Kathleen. Judy Savage. Randy Thompson, up next, Sheriff, followed by Susan Delaney.
Good afternoon, Senator Sarlo, honorable members of the Senate Budget Committee. I'm Judy Savage, Executive Director of the Council of County Vocational Technical Schools. Thanks for the opportunity to speak today. Last year was a great one for New Jersey's county vocational technical schools, largely because of your support for the Career and Technical Education Bill package that was sponsored in the Senate by Senator Ruiz and Senate President Sweeney. This legislation strengthened New Jersey's focus on career readiness, and it took some initial steps toward expanding career and technical education programs in New Jersey. Grants provided in the last two budgets incentivized creation of 7 new career and technical education programs in high-demand industries this year, and 6 more new programs to be launched in September. And as a result, students have new opportunities in advanced manufacturing, STEM, computer science, public law and public safety, culinary arts, and other areas. All of these programs are partnerships with employers, with colleges, and even with local school districts. And restoration of funding for adult high schools and adult career and technical education programs in the current year is helping to preserve some low-cost training options that prepare residents for employment. And we hope that this can be continued in the next budget. County vocational schools are enormously grateful for your support of career and technical education, and attached to my testimony is a more detailed report on the first-year results of this bill package. Nevertheless, we need to say that like all school districts, vocational schools are very concerned about the impact of stagnant state aid. Certainly, we appreciate the slight increase proposed in this year's budget by the governor. However, while the formula was run, schools are being allotted only 3.5% of the increase they're entitled to under the formula, plus $10 per student. So just to clarify, I'm not saying a 3.5% increase. I'm saying 3.5% of the increase that the formula says they should receive. This limited increase still doesn't make up for the cuts that occurred back in the 2011 budget. 17 of our 21 county vocational schools will get less aid next year than they did 7 years ago, despite an overall statewide increase of 12% in enrollment. At the same time, vocational schools have suffered from limited funding at the county level. Unlike local districts, which can increase their tax levy 2.5% a year, vocational schools have no taxing authority. Their local funding comes from freeholders that are also feeling the pinch of a tax levy cap. Finally, adult education remains critically important. Unfortunately, the governor's proposed budget eliminated the funding that the legislature allocated for this important need in fiscal year 2016. And we respectfully request that you maintain the current level of funding for next year. Our state needs to have a safety net for students who don't succeed in a traditional academic setting. High school completion and career training programs are vital. So in summary, we want to thank you for your strong support and ask the legislature to continue to maintain the investments in career and technical education that you've been able to make in the past 2 years. These will pay positive economic dividends for New Jersey and its citizens. Thank you.
Thank you. Randy Thompson, followed by Susan Delaney, followed by Valerie Sellers. Valerie here? Okay, you will be up third, followed by Ann Garcia. So it's Randy Thompson, followed by Susan Delaney, Valerie Sellers, Ann Garcia.
Chairman Sarlo, Vice Chairman Stack, members of the committee. I want to thank you for the opportunity to have input on your budget process. My name is Randy Thompson. I'm the organizer of Help Not Handcuffs. We're a nonprofit organization that seeks to remove arrest and coercion from the treatment of drug-using populations as well as persons in early recovery. By doing this, we advocate for a robust recovery support system that empowers the individual rather than disempowering them, so that they can make their own decisions, self-direct their own services, and not have fear of any punishment or reprisal from our state institutions. I want to point out to you, the chart to my left, that the state has incurred a significant expansion of drug possession arrests. We learned earlier this year from New Jersey United for Marijuana Reform, of which our organization is a member, that marijuana arrests are soaring, but all drug possession arrests are increasing. And starting in 2011, we had 32,500 drug possession arrests, escalating to nearly 40,000 in 2014. I just want to take a minute to talk about the war on drugs. When we mention that, there's building consensus that it is a hurtful, violent, and failed policy, but there's a lot of deflection away from what the war on drugs is. The war on drugs is drug prohibition. When we prohibit something, that is a bedrock foundation that we use to rationalize our use of violence towards people who use drugs, whether or not they've done any harm to person or property. Ironically, people who use culturally acceptable drugs don't suffer any consequences whatsoever. People who are arrested for drug possession face disproportionately harsh use of force and violent risk exposures, including arrest-related deaths, police brutality, as well as deaths, sexual assault, physical assault, and exploitation in jails, should they make it there, as well as those risks sometimes in behavioral health facilities, should they be there. This is in addition to the intentional harm of arrest, which creates barriers to employment, housing, and education. It's important to note that this meets the World Health Organization's definition of violence. These risk exposures were the topic of our presentation last month at the United Nations, which is relevant to this discussion because global drug policy is poised to shift away from drug criminalization towards protecting the human rights of individuals. So when we look at our budget and we see that there's highlights of treatment, addiction, and reentry, we have to understand that we're not paying attention to our continued commitment to the war on drugs. Additionally, this fosters false stereotypes about people who use those drugs who often don't go on to regular use or to form an addiction or to even commit a crime. I want to skip down a little bit. I know that many of you have advocated for programs like Drug Court. This is not a slight on your efforts, but this is to point out that programs like Drug Court have carried over some of the very hurtful beliefs of the war on drugs, most notably the belief that the constant threat of violence or the use of force is appropriate and produces healthy outcomes. And this is with the knowledge that compulsory treatment is less effective than voluntary treatment. Many health providers do rely on people being forced into their programs. That creates an institutional bias and it's unhealthy for our entire community. And we're asking that you use your budgetary process. Many of these are legislative issues that would need their own legislative action to address them, but at your budgetary process, you can constrain some of the appropriations and make demands of those monies. So we would just like to recommend that when you're making law enforcement appropriations, that you ask them to eliminate or reduce drug possession arrests. You also ask your prosecutors before you fund them, the county prosecutors, to end the use of strict liability, an exacerbated drug war tactic. We'd also like to see some civilian review of police departments, and we'd like to see diverting some of those law enforcement funds to harm reduction and to other critical life supports, which are often ignored, like housing, that are in even bigger deficit than treatment, things of that nature. We do oppose the $64 million drug court appropriation for the reasons I listed above, and we certainly would oppose the reopening of mid-state prison. We would like to see less prisons, not no in there. There's a few more recommendations. It looks like they're running out of time, but it's in my written testimony.
And I will say this, I think you know this, the culture is changing. Democrats and Republicans alike, they're even on the presidential campaigns talking about mental health, drug addiction being a mental health issue. And we have to change the culture of how we approach this. So people like you and your organizations are working. You're educating a lot of folks that it's a mental health issue and it needs to be addressed in a different way.
Thanks, Senator.
Susan Delaney.
Good morning. Mr. Chairman and members of the Senate Budget Committee, thank you for the opportunity to appear before you today to request continued grant and aid funding from the state of New Jersey to the Coriell Institute for Medical Research. My name is Susan Delaney, and I am the Director of Government Affairs and Policy at Coriell Institute. Based in Camden, New Jersey, Coriell Institute is a respected nonprofit research center where scientists are leading programs in precision medicine and cell biology, and is home to perhaps one of the world's largest biobanks, designed to support the research community and their mission to improve human health. With your permission, these remarks summarize our final testimony, which I hope will demonstrate that the state's continued investment in Coriell is continued investment in the biomedical leadership of New Jersey. I am pleased to report that Coriell Institute is projecting $16 million in new and continuing federal and non-federal revenue in 2016. With $10 million provided by the National Institutes of Health, this means that for every dollar invested in Coriell Institute by the state of New Jersey, the state will see a return on that investment of more than $10 in federal research dollars. Our partnership with the United States Air Force continues to flourish, and we are exploring several research questions related to sleep, obesity, and cardiopulmonary fitness. We have also been invited to collaborate with the newly formed Total Exposure Health Team at Air Force to assist them in incorporating genetic information into their new studies. Coriel has continued its commitment to the National Institutes of Health. This month we attended the American College of Genetics and Genomics annual conference, and the reach of our work is really evident at meetings like these. Researchers all across the country rely on Coriel repository collections to advance their research. Your investment in Coriel is also an investment in education. Celebrating its 35th year this coming Saturday, the Coriel Science Fair will host more than 300 students from grades 6 through 12 who attend schools in Burlington, Camden, and Gloucester counties. We hope that their experiences competing in the Coriel Science Fair will encourage them to pursue their interest in the sciences. And finally, Coriel employs 95 scientists and staff with a gross payroll of $9 million, generating more than $150,000 in payroll taxes for the state. On behalf of Dr. Chrisman and the researchers of Coriel Institute, I respectfully request the state's continued support that provides us with the capacity to explore new research ideas, provide employment opportunities in the field of biomedical research, and to remain an anchor for first-class science in Camden, New Jersey. Mr. Chairman and members of the Senate Budget Committee, thank you for your consideration, and I'm happy to answer any questions you have.
Thank you. Thank you. Thank you very much. The next person will be Valerie Sellers, Chief Executive Officer, New Jersey Association of Community Providers.
Thank you. Good afternoon. I'm going to be brief because I know you've had many people before me and many people after you. So, in summary, we have an expanded testimony, but what we're asking is that you support the $79 million that is reflected in the state fiscal year 17 budget. It is an additional funding, and it's intended to reduce the waiting list, allow for more housing vouchers, as well as services and supports for individuals with intellectual and developmental disabilities. This funding is critical because as I listened to the testimony prior to me, I heard that somebody was 1,300 and something on a waiting list for services. I just find that absolutely appalling, and I know of families that have been on that list for more than 10 years. So the funding is very much needed and is very much appreciated. And also within that funding is $10 million for providers, and that is necessary to help them build the infrastructure for the transition to fee-for-service. We requested that last year. It was a budget resolution. Unfortunately, it was not allocated, but we do ask that you support it in this year's budget. I think the other point that's important to raise, and you've heard it from others in our field, is that we're facing a crisis. You probably hear that from everybody that comes up here. It's a crisis situation. But in going to national meetings, we are finding that we cannot recruit and retain direct support professionals at the wages that we pay. Wages are $9.50 to $10 an hour. You can't maintain a workforce. There is a 44% turnover rate in this field, and it takes anywhere from 8,000 to 9,000 to adequately train a direct support professional, only to have them leave 8 months later. But more disconcerting is the fact that they form relationships, and yet they're challenged with, do I take another job, do I take a second job, or am I on public assistance? Those working within the developmental centers and comparable positions make $40,350. A direct support professional in the community on average makes $24,257, and the poverty level is $24,350. This has to be addressed because as we move people into the community, we have to ensure that we not only have an adequate workforce in terms of numbers, we have to have a well-trained workforce to care for some of the most vulnerable individuals in our communities. So we will be launching a campaign, the Three Providers Association. I'm not sitting here asking you for money for that today because I realize there are many, many competing needs. We're simply asking that you sustain the $79 million and that you be open and receptive when we come to you to ask, if you will, for additional funding to raise the wages. We're looking at $15 minimum wage. If you have any need for information, you certainly can reach out. We'd be happy to provide you with more statistics.
Thank you.
Thank you.
Thank you very much. The next person is Ann Garcia, Executive Director, Vineland Public Charter Schools.
Thank you, Mr. Chairman and committee members, for the opportunity to speak to you today. My name is Dr. Ann Garcia, and I am one of the founders of 3 charter schools in Cumberland County. Sad to see that Senator Van True is not here today because he knows us. We are not operated by an EMO or CMO. We are just operating by ourselves, or in the business what we call mom and pop charter schools. Presently, I'm the executive director for the Vineland Public Charter School located in Cumberland County. VPCS has been in operation for the last 7 years and is a high-performing Tier 1 charter school. VPCS is a diverse school with approximately 60% of our students eligible for free or reduced lunch. VPCS has to do more for less and is held to a higher level of accountability than the local public district. I'm here today because, as you know or should know, Cumberland County is the poorest county in the state of New Jersey currently. And this has created many challenges for us and our charter school students. We're asking for help. Some facts on our charter school. The Vineland Public Charter School is located in the city of Vineland in Cumberland County. Cumberland County right now is the poorest county in the state of New Jersey, as I took from an article at USA article that was published January 10th, 2015. The Vineland Public Charter School has been operating since 2009 and is a Tier 1 charter school. Might ask what Tier 1 is? It's a measurement given by the New Jersey DOE for the highest performing charter schools in the state of New Jersey. Vineland Public Charter School has a school span of kindergarten to 8th grade, and next year we've been approved for an expansion to 9th grade. Now some of our funding facts. In 2015, Vineland Public Charter School received an average of $9,200 per pupil. But for 2016, we received less than that, $9,129 per student. We are the lowest charter school that per pupil cost in the state of New Jersey. To put this into perspective, the average per pupil cost for a New Jersey charter school, as calculated in the Taxpayer's Guide to Educational Spending for 2014, was $16,324. And for the 2015, it was $16,711. This report delineates the educational spending for the last 2 years. So for the 2015-16 school year in the proposed budget, Vineland Public Charter School is projecting an operating budget at $7,579 less per student than the average amount that other charter schools are receiving in the state of New Jersey. Vineland Public Charter School is doing more for less and is a very high-performing charter school. We did not receive a number of state aids, but the most significant is the adjustment aid. Vineland Public School District receives adjustment aid of approximately $34 million. This state aid does not follow the student and will really help our students, would help our students with an additional $3,800 per student, or over $1 million in our budget. Since the local school district has had excess free balance over the last few years, we should be allowed our share of the adjustment aid. I think my time is up. I'll leave you this statement and also graphs that we did for the funding that we received compared to others. Thank you very much.
Okay, the next 3 are going to be Alan DiStefano, Executive Director, Cape Atlantic Integrated Network for Kids, Mark Michelson, President and CEO, Spectrum for Living, and Christy Buteas, Home Care and Hospice Association of New Jersey. Thank you.
Good afternoon. I want to thank the Senate Budget and Appropriations Committee for giving me the opportunity to testify. My name is Alan DiStefano. I'm the Executive Director of Cape Atlantic Integrated Network for Kids. We are the care management organization that covers Cape and Atlantic counties, providing high-intensity care management services to kids for Cape Atlantic. I'm testifying actually on behalf of the 15 care management organizations within the state of New Jersey under the New Jersey Division of Children's System of Care Services. We asked for the committee's support to help restore our Medicaid rate to the level that was 15 years ago when the system of care began in 2001. Initially, CMOs were designed to work with the top 5% of kids with the most complex behavioral health needs to ensure that these kids and families at this level of intensity received as much attention as needed. Caseloads are capped at 10 kids per care manager, and the agency could not exceed an overall caseload of 200 kids. Fast forward to 2012 and 13, all CMOs went through an expansion of our care management services by including a population of kids who, although were not considered at the top level of clinical complexity, population still required face-to-face care management. The expansion of CMO contracts included new mandates. The caseload ratio is now up from 1 to 10 to 1 to 15, but the agency caseload cap was removed, putting care managers' caseload at greater risk to go to 1 to 18 kids or beyond. Now, although caseloads were higher per care manager, sometimes by 8 to 10 kids per care manager, the same comprehensive and exhaustive child family team process was required. And equally as daunting, there's no flexibility given to the timelines required by Medicaid in order to bill for services rendered. But the biggest, most difficult, and damaging change in this business model is that our Medicaid rate was cut by 53%. Although CMOs understood that this was an unsustainable financial situation, we all worked with the CSOCS to help usher in new populations to be served, including children, youth, and young adults with substance abuse challenges or very complex developmental or intellectual disabilities. CMOs are in a very precarious financial situation because unlike a regular nonprofit organization, CMOs are restricted to providing only care management services by contract. We strongly believe that this singular focus on care management has been fundamental to the success of CMOs and the CSOCS in general, but most nonprofits are able to spread costs across multiple contracts. The only way CMOs can increase cash flow is to increase the actual amount of youth served. Unfortunately, the present low rate demands that we have high caseloads to be able to continue to operate our budget. This increase in our caseloads threatened our very successful way in delivering care management and maintaining a highly skilled and motivated workforce. Many CMOs have experienced high turnover rate staff due to this. Additionally, we are unable to negotiate our own Medicaid rate, and even though it accounts for 80 to 85% of our budgets. And since the beginning of our first contract in 2001, we've been prohibited from really fundraising to put additional dollars into our budgets. So on behalf of the 15 CMOs, I asked the Senate Budget Committee for support in restoring our Medicaid rate back to the level it was 15 years ago. That rate, in fact, was $850 per month per kid served. We do not get this increase. There's no doubt that the quality of our care management service will suffer and have a direct negative impact on the 22,000 unduplicated youth that we serve on a yearly basis. Thank you very much.
Thank you very much. Next, we have, do we have Mark Michelson here? Michelson. Thank you.
Thanks again.
Thank you.
Chairman Sarlo and members of the Senate Budget and Appropriation Committee, I thank you for having me here today. My name is Mark Michelson. I'm the President and CEO of Spectrum for Living, which is a family-founded and family-driven nonprofit organization that's contracted by the state serving individuals with intellectual and developmental disabilities. We care for over 800 consumers, 232 of whom live in community residences, to include the only community integrated intermediate care facility in the state of New Jersey. We also provide adult training centers, a day program, case management, recreation services, and in-home support. Core to Spectrum's mission is serving individuals with the most complex medical conditions and multiple physical disabilities. More than 50% of the people we serve are non-ambulatory and require moderate to full assistance with their activities of daily living. We also provide to consumers personal and healthcare needs and the capability to achieve their fullest potential. In the past several years, it's been increasingly more difficult to sustain the quality of services we provide due to inadequate state funding. The cumulative effect of 8, now going on 9 years of no cost of living adjustment or increase in our contractual rates provides no solid fiscal ground to reconcile rising costs of goods and services, most significantly healthcare costs. Based on a national medical index, there has been an increase of 70.1% in healthcare costs. Just in the past 2 years, Spectrum for Living has experienced a 33% increase. Yet revenue remains flat. Based on Social Security Administration, the median wage in the United States has increased 11.1%. Due to inadequate funding, Spectrum, like our peer agencies, cannot fund the cost of salary increase without compromising client services. This has resulted in a high vacancy rate fluctuating between 18 and 22%, and is unfortunately becoming far too common in our field of work. Our turnover rate exceeds 25%, resulting in a loss of thousands of dollars in training, time, and costs. For many of our direct support professionals or direct care workers, they work multiple jobs just to earn a living wage. It should be said of direct care that they are undervalued, underpaid, yet they're the most valuable people we have providing services. From the family's perspective, they are godsends. From the consumer's perspective, they are their best friends. And I will rush. Spectrum operates 29 facility sites, many of which are barrier-free residents built ground up. We are grossly underfunded to maintain those homes with necessary capital improvements due to over years of depreciation. Aside from the efficiencies gained by technology, it is now mandatory under fee-for-service for Medicaid billing, yet there is no funding in our budget to build, purchase equipment and software. Like our peer agencies, we can no longer be able to sustain the current level of quality services without significant increase in our contracts. Consider that there are 1,000 emergency placements for adults in nursing homes throughout New Jersey, trying to access community residents that provide the proper supports and level of personal care they require.
Sir, could you wrap up?
I will wrap.
We have your written.
I will wrap it up. I ask that you provide us with a cost of living increase that we desperately, desperately need, and would really appreciate that. Thank you.
Thank you very much. Chrissy? Home Care and Hospice Association of New Jersey. I thought I was pronouncing your last name wrong.
You did a great job, sir.
I know you so well, and I never know how to pronounce it.
Thank you. Good afternoon, members of the committee. My name is Chrissy Budas, President and CEO of the Home Care and Hospice Association of New Jersey. We represent the state's Medicare certified home health agencies housed in the Department of Health. Our licensed healthcare service firms in the Division of Consumer Affairs and hospices back in the Department of Health. I included my written testimony, so I will try to be brief and just summarize some of the main points for you. What I included in our testimony is a recent report basically which proves what many of us have thought and who support home care in New Jersey, that patients who utilize Medicare home health care after a hospital stay are at least 30% less likely to require another hospitalization within 30 days. And in doing so, this study has proved that we have saved Medicare millions of dollars. So as you explore policies, in the healthcare arena, we encourage you to look at future policies that further encourage folks to remain in their home, which is obviously where we know a lot of folks want to remain. So if you have any questions on the study, please let me know. A couple of things I just wanted to bring to your attention, and again is included in my written testimony, is around some of the workforce challenges that we are experiencing in the home and community-based care. And I'm sure several other folks have come up and talked with you about some Medicaid reimbursement, and unfortunately we also have some of the similar concerns around reimbursement to make sure that we have a qualified, adequate workforce in the home and that we're able to service the state's Medicaid population. As you know, it's very challenging in a managed care environment in terms of rate setting and meeting those demands. So we are looking for, in the upcoming budget, to have the legislature include a provision that would not allow the managed care organizations to drop below reimbursement of current fee-for-service levels for personal care assistance. So you'll see that in my written testimony. Our challenges are further complicated, and I do need to acknowledge all of the work that the New Jersey Board of Nursing is doing with addressing some of our concerns. But again, severe certification delays are experienced by getting our certified home health aides license at the Board of Nursing. So anything that the legislature can do to ensure that the Board of Nursing has the funds and the staff and the resources it needs to process these applications in a timely manner would greatly impact and be an asset to our agencies so that we have the workforce ready to go in the home. I also just wanted to bring to your attention some of the challenges that we're experiencing regarding the operation of some firms that are not licensed in the state of New Jersey. So we just want to ensure that the Division of Consumer Affairs has all the resources it needs to do proper enforcement of these online firms that are, in our opinion, skirting some of New Jersey's laws and regulations. So with that, I will conclude because my time has ended, and if you have any questions, please let me know. Thank you for your time.
Thank you very much. Okay, the next three are Audrey Pittman. Could you raise your hands if you're here? Okay, you're next. And then after her, Gina Platino. Are you here, Gina? Okay. And then Jas Marie Arce. Jas Marie. Okay. And then Jacob Tucci. You're next. Okay.
Good afternoon, members of the committee. Thank you for this opportunity to speak to you today on a program that is very dear to my heart. Again, my name is Audrey Pittman. I'm the EOF Director at Rowan College at Gloucester County. I'm also an alumni from this institution. I'm a graduate of the EOF program also. For the past 16 years, I've been director at Rowan College at Gloucester County, and I have had the pleasure to see our New Jersey EOF students excel academically and personally. The governor's $2.5 million cut to the EOF program, which will return the program to fiscal year 2014. Needless to say, this is detrimental to the program's Article 3 and Article 4 funding. This will affect program services and support staff. The restoration and increase of funds will allow the program to help further support the students and staff towards achieving and maintaining its high success rate among graduating students from low-income backgrounds. Students enrolled in our EOF programs are some of the best and brightest in the world. While many may have come from economically challenged backgrounds, our determination and spirit is embodied in all that is strong and great of New Jersey. The EOF program is very important to me, other EOF students, and to our state. Student success starts with a well-supported EOF program which allows educational affordability and access to higher education. Again, thank you for the opportunity to speak about a program that's dear to my heart.
Thank you so much.
You're welcome.
Thank you. Jacob? It's good. You're on.
I'm currently a freshman at Rutgers University in Camden. I'm concerned about the $2.56 million budget cut that will happen with the EOF department statewide. I was in the New Jersey foster care system when I was a young boy, and I had to endure living with other youth, and I would always dream about going to college and becoming a success story. Many years later, I applied to Rutgers Camden and was admitted through the EOF department, and I began the Summer Institute in 2015. That is where I met my amazing and respected EOF counselor, Dr. France. He has been very influential in my life, and if this budget comes into action, I might not be able to see him anymore. He and many other EOF counselors at Rutgers Camden are helping me pursue my dreams and make them become reality. I'm blessed to have so much encouragement and love that I've never received when I was a child, and if you take this away, it will be hard for me to continue my education. Those $2.56 million means a lot to people that have very little in their lives, and especially mine. I currently have to take out loans to help pay for my education at Rutgers Camden, which is, it is difficult, but it is where you spend money to make money. I am involved with the university, with the Residence Hall Association, and I speak on behalf of the residents and bring the concerns to the director as an advocate. I'm also in BIGS, which stands for Bridging in First Generation Students.
and my involvement in BIGS is that I volunteer with community projects in Camden, New Jersey. As a full-time student, I'm independent and I do not receive enough funding from the state. Since my matriculation at Rutgers Camden, the UF department sets up workshops for the fall and spring to prepare students for them to graduate and complete college successfully. That is another big thing that helps with the 2.56 million. And it's very detrimental. UF students that are commuters only receive $575 a semester to help pay for the cost of education, which is not a lot to help cover the cost of tuition from the state. Full-time students, the dorm only receives $700 a semester. Which I'm a full-time student, and it's it's not a lot. It would be grateful if there was another 2.56 million added on for the year. Thank you.
Your story is very impressive. I want to wish you the best of luck. I'm sure everybody on the committee does.
Absolutely. Jacob, you're already a successful story. Keep up with the perseverance and determination. You'll be there. Thank you.
Right. Good luck. Okay, the next three are Linda DeFelice, Professor, Joe Marlowe. Linda, are you here? Could you raise your hand? Okay, Joe Marlowe, are you here? All right. And Lisa Parles, are you here? Lisa Parles. Okay, we are the next two.
Good afternoon, committee members, and thank you for providing this opportunity for testimony. My name is Linda DeFelice, and I am a resident of Camden County. I am also a proud supporter of family planning, and I am here today to ask for the restoration of family planning funding into the New Jersey state budget. The family planning center that I know best is Planned Parenthood of Southern New Jersey. Planned Parenthood has been a trusted source of high-quality, affordable health care in my community for over 80 years. People go to Planned Parenthood not to make a political statement, but to receive compassionate and non-judgmental medical care, which is trusted and affordable. That's because despite what some politicians and pundits might say, access to reproductive health care is not a partisan issue. The reality is that cuts to the family planning budget in New Jersey took away the health care that women relied on in our state, including cancer screenings and affordable birth control. After the funding cuts were originally made in 2010, 6 family planning health centers across the state closed, and many faced reductions in services and hours of operation, leading to an increased wait time for family planning services, many of which are highly time sensitive. In short, these funding cuts have played politics with women's lives. Supporters of family planning services know that the best way to prevent unintended pregnancies and the transmission of sexually transmitted infections is to invest in and ensure more women have access to affordable, quality, reproductive health care. As an educator for over 40 years, with 33 of those years as a professor, I have seen the critical importance of family planning services in the lives of my students. Accurate, comprehensive sex education, non-judgmental counseling regarding birth control, and testing for sexually transmitted infections are examples of services needed by college students. Such services allow women to make informed decisions about their reproductive health care. As a result of making informed decisions, women can then take better advantage of educational and economic opportunities thus improving their own future and that of their families. Family planning is smart and sensible and needs to be a vital component of our state budget. I ask that the New Jersey legislature helps the women of our state access these services by restoring funding for family planning services in the state budget. Thank you very much.
Thank you.
Good afternoon. My name is Joseph Marlowe, and I'm a resident of Camden County. I'm here to offer my testimony on the importance of investing in family planning services in the state budget. I have a Master of Public Health degree, and I've studied the significant return on investment associated with investing in family planning. Family planning services encompass a wide range of reproductive health services for women and men. The testing and treatment of sexually transmitted infections, known as STIs, is a core service of family planning providers that helps keep individuals healthy and safe. Here in New Jersey, our family planning providers offer testing and treatment for a wide range of sexually transmitted infections, including gonorrhea, chlamydia, and syphilis. However, after funding for family planning services was eliminated from the state budget in 2010, health centers across the state were forced to cut back hours or staff or close their doors altogether. Health centers have struggled to keep up with the demand for STI testing and treatment, which is an important component of the family planning medical visit. Last month, new data showed an alarming trend. In 2014, more than 37,000 bacterial sexually transmitted infections were diagnosed in New Jersey. This means that since 2009, the last year that family planning services were funded in the state budget, the rate of bacterial STIs has risen more than 27% statewide. In 1/3 of state counties, the rate has risen nearly 50% or more. And in 4 of the 5 counties where health centers closed after the 2010 funding cuts, the rate has risen higher than the state average. These trends underscore an alarming fact. As state funding for reproductive health in New Jersey declined, the health of our most vulnerable population has suffered. Sexually transmitted infections, if left untreated, can lead to serious issues like infertility and certain types of cancer. Having an STI can also increase the chances of getting HIV. Clearly, state funding cutbacks have taken a toll, with reduced numbers of women being able to access family planning health centers for their reproductive health care. By restoring state funding for life-saving and life-changing preventive health care services such as cancer screening, contraception, testing, and treatment for sexually transmitted infections and HIV, AIDS, state Senate action would support more than 1 million New Jersey women in need of contraceptive services, of whom 320,000, or 1/3, have income less than 2.5 times the poverty rate. Women of color are disproportionately disadvantaged by lack of access to the full range of reproductive health services offered by family planning services. Facts are facts. To work on reversing this alarming increase in sexually transmitted infections and deteriorating access to publicly funded reproductive health services, New Jersey must restore its investment in family planning services. Please include family planning funding in the state budget. Our health depends on it. Thanks for your consideration.
Thank you, Mr. Marlowe. Okay, for those who are not here this morning, welcome to the afternoon session of the Senate Budget and Appropriations Committee. We're moving through the agenda quite nicely. Thank you for everybody's cooperation and patience, and to our staff here at the Office of Legislative Services for setting this up, and the accommodations here at Rowan University. We will call you up by three at a time. One comes up, the other 2 come to the front row. There's a light here, it gives you about 3 minutes. If you have written testimony, we urge you not to read it. All of your testimony will be scanned and the transcripts will be provided to all of our staffs, to the members. Any testimony you provide also is being recorded and will be put on the internet. We don't ask a lot of questions here. We listen, we take the information. Members are popping in and out, so please don't think that nobody is paying attention. As long as you have 1 or 2 members up here, we are able to gather your testimony. So thank you for your interest in the fiscal year 2017 budget. Lisa Parles. Lisa here? No? Okay. Ken Wolski. Ken, come on up, sir. Coalition for Medical Marijuana. Is Denise here? Buzz? Denise, come up to the front row. Is Dana Palmer here? Dana, come up to the front row. Is Denise Venturini here? Come up to the front row. And Lisa, I don't know Lisa, right? Okay. Ken?
Thank you, Chairman Sorlo and members of the Budget Committee. My name is Ken Wolski. I'm Executive Director of the Coalition for Medical Marijuana New Jersey. We're a 501c3 nonprofit educational organization. We're all volunteers, and we've been around since 2003. I'm a registered nurse. I've been an RN in New Jersey and in Pennsylvania for 40 years. 25 of those years I worked for the state of New Jersey, 4 years at Trenton Psychiatric Hospital, and 22 years in the New Jersey prison system. So I'm very familiar with state institutions. I'm here today not to ask for money, but to give you an idea of how you can save a significant amount of money and also improve patient care in the institutions. And that is by making medical marijuana lozenges available to patients in public and private institutions. Now, we all know that medical marijuana is recognized as medicine by the state of New Jersey, and we've had a program in place since January of 2010. Unfortunately, the program is very restrictive, and only about 5,000 people in the state have taken advantage of this program in a state with almost 9 million residents. But last year, the Department of Health came out with guidelines for the manufacture of medical marijuana lozenges. And there is no reason that these lozenges cannot be given to patients in these institutions to improve their health. All that is needed is a doctor's order and the lozenges. These lozenges would have, they can be made in consistent and reliable products that will have accurate dosing information, side effects and adverse effects and drug interactions will be included along with these lozenges, and they can replace expensive pharmaceuticals, they can replace the need for hospitalizations, they can replace the need for surgical procedures, and they can replace the need for emergency transport. So this is, this can save the state and these institutions hundreds of thousands of dollars, if not millions of dollars every year. And I have a proven track record, as you'll see from my development of the program of telemedicine while I was with the Department of Corrections. Let me see. Marijuana just has tremendous therapeutic potential, and one of the best things about marijuana is that it can treat comorbidities. So we have seen, for example, when a patient is given marijuana to treat seizure disorder, that the autistic behavior is also calmed and treated effectively. The state of New Jersey has one of the most restrictive medical marijuana programs in the country in terms of its very few qualifying conditions. But the truth is that you can really treat several coexisting conditions when you treat one of the underlying conditions. So thank you for your attention, and if you have any questions, I'd be happy to answer.
And I see they gave you a letter back on March 11th?
Well, that was from the ombudsman, ombudsman who is assisting in this procedure.
In this procedure. Oh, they're working with you?
Well, yes, they're working with me.
Okay. Well, good luck, Sarah, and thank you for bringing this to our attention.
Well, thank you.
Denise? Denise Buzz? Oh, Denise Buzz. Nope. Dana Palma, then Denise Venturini. Dana Palma with the Inspira Health Network Life.
Good afternoon, and thank you for the opportunity to provide testimony. My name is Dana Palma, and I'm Director of Finance for Inspira Health Network Life, which is a subsidiary of Inspira Health Network, a health system serving Gloucester, Salem, and Cumberland counties. Life is referred to as Living Independently for Elders and is nationally known as PACE program. PACE is a program for all-inclusive care for the elderly. I'm here today as one of 5 PACE programs in the state of New Jersey, and my request is to maintain funding per enrollee at the same level to allow for continued growth for the entire New Jersey PACE programs. PACE is a unique community-based care delivery model that provides a continuum of medical and supportive services in order to maintain the well-being of seniors in the community whom are otherwise assessed to be nursing home eligible. PACE bundles Medicare and Medicaid payments to provide a full range of services for a fixed rate. This allows the state the ability to predict costs for their long-term care population. Under a 3-way contract between the Centers of Medicare and Medicaid Services, the state, and the PACE organization, PACE provides traditional and a wide range of non-traditional services such as home modifications, transportation, and other tailored needs for our enrollees. This flexibility is a key reason why PACE is successful in reducing unnecessary emergency room visits, hospital admissions, readmissions, and nursing home admissions for the most vulnerable. As payer and provider of all needed services, PACE organizations, such as Inspira Life Program, are incentivized by being fully at risk. Under capitation, our goal is to offer the right care in the right setting for the right amount of time to achieve the best possible outcome. In the absence of PACE, almost all participants would need to live in a nursing home. As the Medicaid portion of the state budget grows, PACE provides a cost-effective alternative to permanent home placement. Even though all PACE participants have been certified by the state as clinically eligible for nursing home care, over 90% continue to reside in the community. PACE is fully accountable to the patients, families, and the government for the care and quality of care, accepting 100% responsibility for the cost and quality of care across all providers and settings. The results have been better health outcomes, better value, and savings. I am here today as PACE is aligned with the state's goals and increasing home care and community-based while reducing the use of institutional settings. There's an opportunity for the program to significantly grow in many parts of the states, yet past budget cuts current providers are hesitant to expand their programs, and potential providers sit on the sidelines, waiting to see where the future funding is headed. The reality is that the further budget cuts are not sustainable and threaten the viability of this program, and ultimately the quality of life for our participants and families. On behalf of the New Jersey PACE programs and our participants, we ask that you continue to maintain funding per enrollee at the same level and to allow sustainable growth for this essential program and our most at-risk members and the communities. In my testimony, you have received a list of the current PACE programs in New Jersey, as well as 2 success stories and other testimonies from our participants and families who have been touched by our program that we serve. Thank you.
Denise Venturini?
Yes.
As Denise is coming up, is Angeline here? Angelina Carrion? Come on up, Angela. New Jersey Work Environment Council. Is Ann Dorsett here? Ann, come to the front. Michael Piper.
Ready? Good afternoon. Good afternoon. Thank you for this opportunity. I am here representing Cape Hope. We are a homeless advocacy group in Cape May County, a 501c3. And Merriam-Webster defines community as a group of people who live in the same area and share the same interests. Such activities as religious affiliation, social groups, access to schools and recreation, and affordable housing all make a healthy community. When one or more of these pieces is missing or unattainable, the community suffers. It is vital to a healthy community that all the pieces are within reach to everyone. Communities in South Jersey need a focused approach to ending homelessness. Currently, there are tools that help us not only achieve this, but also save taxpayers substantial dollars, which can be reinvested back into the community. It is urgent for Cape May County to join the other counties of New Jersey that have adopted the Housing First model. Cape May, New Jersey is a smaller county in the southern tip of the Garden State, rich in history, beautiful beaches, and fabulous restaurants. According to the 2014 census, Cape May population was 95,344. Although Cape May County is a smaller rural area compared to the other 20 counties in New Jersey, it suffers from poverty, unemployment, and crime just as much as the larger urban counties. In addition, being a seasonal community, it lacks a stable year-round employment base. The unemployment rate is 12.3% and 13.9% live in poverty. Individuals that are discharged from current transitional housing is only 3% versus the Housing First success rate discharged from the program in base models that have been brought to the attention, to our attention, are 95%. In recent years, Cape May County has seen a rise of the amount of homeless persons, families, children, and veterans in its boundaries. Cape May County has the highest rate of unemployment, children in and out of placement, and juvenile delinquency in New Jersey. Some of these issues stem from homelessness and lack of supportive services. Poverty and unemployment and homelessness have a negative impact on the quality of life for people and families living in Cape May County. These individuals, families, and the community as a whole would benefit from the Housing First model. The Housing First model offers wraparound supportive services which help build a healthy community. Funding for Housing First is necessary for Cape May County to have access to affordable housing solutions and supportive services to end homelessness. It is vital to send a positive message to the southern tip of New Jersey and to continue to find and support new ways to support Housing First programs. Thank you for your time.
Thank you. Angela Carioni, New Jersey Work Environment Council.
Good afternoon, members of the committee. My name is Angelina Carrion. I'm the Healthy Schools Now campaign organizer at the New Jersey Work Environment Council. Before that, I was a public school teacher for 10 years. During the months of June and September, my classroom temperature would reach 93 degrees. Dense humidity caused puddles to form, and the metal desks would rust and stick to the floor. My students sat sweating and had difficulty breathing. Some suffered from asthma, which we know is a leading cause of absenteeism. Now in my current position as Healthy Schools Now campaign organizer, I visit schools in Newark with moldy, water-stained ceiling tiles, peeling paint, deteriorating floors, and poor ventilation. All signs of aging buildings that need more care. Statewide, parents and teachers tell awful, heartbreaking stories of schools rife with mold, asbestos, and pest infections. And I'm sure you're all aware of the headlines in Newark. 30 schools were recently found to have tested above acceptable levels for lead. They joined the ranks of Jersey City, Patterson, and Trenton, communities that have also faced lead issues in their schools. Every day, children across the state attend schools in these deplorable conditions. While building maintenance cannot fix these disgraceful conditions, it helps schools function better. Dedicated custodians and maintenance workers try their best to maintain buildings by working to prevent the buildup of dust, mold, and safety hazards. but properly maintaining buildings has become nearly impossible due to severe underfunding and strict budget cuts. In a building that requires 8 or 10 maintenance personnel, districts have been forced to slash crews down to 1 or 2. However, appropriate maintenance would help extend the life of buildings. Study after study tells us school facility conditions affect students' educational outcomes. A data analysis of school facilities in New York State found unsatisfactory facility conditions result in higher suspension rates, lower attendance rates, and lower math and language arts test scores. SDA funding is supposed to fix some of these issues in our most underserved districts, but with their funding nearly exhausted and schools starved of funding, how are boards of education supposed to fix hazardous conditions? In 2011, school districts in New Jersey identified 716 emergent health and safety conditions. Only 76 of those were approved by the state to be completed by the SDA. The remaining health and safety hazards became the responsibility of the district. We don't know how many conditions schools were able to repair, but we can presume that in the years between 2011 and 2016, many more issues arose and need to be fixed. With SDA funds almost depleted, critical repairs will have to be made from each school district's budget. These budgetary challenges don't matter to the students who climb crumbling stairs into his school building, carefully step over broken floor tiles on his way to class, and passes by closed-off lead-laced water fountains. He has a hard time breathing in the 93-degree heat in his classroom, and so he sits and stares at moldy ceiling tiles or rat droppings on the windowsill. Tell that student the state of New Jersey finds that acceptable. Thank you.
Thank you for your advocacy.
Thank you.
Ann Dorset. Michael Piper, on deck. Is Megan Tinsley here? Megan Tinsley? Okay. Is Tonya Ahern? Tonya Ahern? Okay. Is Natasha Rosario? Okay, Natasha, you're double deck. Okay, Dan.
Hey, good afternoon. Thank you so much for inviting me or allowing me to speak today. I do want to welcome you to South Jersey because we're very proud of Rowan and we're very proud of our community here in South Jersey. I'm a resident of Gloucester County. I have a farm about 5 miles from here. So I'm here to direct your attention to agriculture and to the services that we have in agriculture. I'm a member of the Gloucester County Board of Agriculture. I've been on the State Board of Agriculture, and so I'm wanting you to excuse me, I'm sorry.
No, I'm sorry. You can keep going.
Okay. I'm wanting to point out the benefits of our own State Department of Agriculture. It's a marvelous direct service to us. The board itself is nominated by the counties and by the county representatives, so it's very much attuned to what we're doing. Level budgeting has caused a couple of things I'm very concerned about. For example, the animal health labs have taken a cut. That's the lab that works with our animal diseases. You know, New Jersey is right on the front line of new and incoming diseases. Right next door, it lives right next door to our public health service. So I'm concerned about that. Another thing, for example, is infrastructure. Staff is aging, but they're not complaining so much. However, the buildings are a problem. One of the main ones being the bug lab. It's a very state-of-the-art research program in entomology, but the building itself is a constant struggle. It needs repairs, maybe even replacement. Right now, I'm also on the board of managers for the Rutgers research stations. That's commonly known as Extension. Right here, down the street, just a few blocks away, is the county extension office. That program, as a land grant program, was charged originally with teaching and skills. That has now translated into the community programs for youth and gardens and clean food in towns and suburbs, as well as farmer education. Need that badly. They're also on level funding, and so I've been concerned about some of the services that we are worried about losing with the extension office, and would hope you pay attention to what they're needing. One of the big problems is that they are being loaded with a over $700,000 pension benefits package that they've not had before, and no increase. You're nodding, you know what I mean?
I know what you mean.
Please consider.
What do you have on your farm?
Oh, I have animals. I have
You have
horses.
livestock?
I have livestock, so that's why I'm concerned about it.
How big is your farm?
It's about 70 acres.
Wow.
It is big for North
What do you have?
Jersey.
You have what type of?
I have family pleasure horses that we raise Arabians for pleasure and show.
Nice.
It's a great livestock.
A lot of work though.
Yeah, well, it's a livestock. It's like a lot of farmers. You know, you go out there every day and you expect to. But what I came and thought I would pound the table about is farmland preservation funds.
Yep.
You know, there's only 3 million left, and it's being scrambled over by 5 counties that are even eligible for it. However, it seems that 969 is going to deal with that nicely if you will fold that into the budget, along with the funding from last year. We're feeling as though it's what we voted for.
Thank you.
Thank you.
We don't have any farmland preservation in Bergen County.
We don't have any farms.
Bergen County, we don't have any farm preservation land. So we're not competing. I'm not taking any of your money. I'm not competing with you.
But it's for the state. We need to keep it.
I hear you loud and clear. It's very important. And it's beautiful down here, by the way.
Thank you. We think so.
Natasha Rosario, Camden Coalition of Healthcare Providers. Hello, Natasha.
Hello.
Is Flohisha Johnson here? Flohisha and Altoris Frazier. Okay. Parents, mom and parents come up. You're up next. Is John Staub here? John, you're up after our parents. Okay.
Good afternoon, Chairman Sarlo and honorable members of the Senate Budget Committee. Thank you for the opportunity to testify today. My name is Natasha Rosario. I'm Associate Counsel and Associate Director of Policy and Engagement for the Camden Coalition of Healthcare Providers. I'm here today to ask for your support for the 3 state-certified Medicaid accountable care organizations in the FY 2017 budget. In 2011, the legislature passed and Governor Christie signed into law New Jersey PL 2011, Chapter 114, establishing a 3-year Medicaid ACO demonstration project in New Jersey that gives New Jersey Medicaid the opportunity to pilot quality improvement initiatives and to find shared savings. The model coordinates the care of our most vulnerable citizens. The ACO identifies those who are high utilizers of hospital care, as well as the barriers to primary care that may prompt these people to instead seek care from hospitals, an expensive and often inappropriate setting for the care they really need. By creating interventions and supports around these patients, the ACO helps patients overcome these barriers and access the primary and preventative care they actually need to help keep them well. In July 2015, the state approved the application of 3 community-based nonprofit organizations to become certified Medicaid ACOs under the demonstration project. Each of our ACOs has obtained the support of 100% of hospitals, 75% of the primary care providers, and at least 4 mental health providers in our respective service areas. Each community has built health information exchanges to allow the providers in our areas to share patient health information. Our ACOs serve Medicaid beneficiaries in Camden, Newark, and Trenton. The Camden Coalition has already begun changing the lives of Medicaid beneficiaries in our community. Our ACO includes over 35,000 capitated patients monthly, which is approximately half the city's population. Since becoming an ACO, we have scheduled close to 4,000 provider visits and have made over 7,000 phone calls to patients. We have also seen marked improvements in a number of patients who are able to see a primary care provider within 7 days of being discharged from the hospital. In February 2015, 18.5% of patients with whom we engaged were able to see a primary care provider within 7 days of discharge. Within 12 months after that, in January 2016, 38.6% of patients with whom we engaged were able to see a primary care provider within 7 days. The story of Peter Bowser highlights the ACO's ability to link our patients to the support services they need within the community. Through a supported housing program known as Housing First, the Camden ACO has been able to connect chronically homeless high utilizers of the healthcare system to housing. Peter Bowser was one such patient. Since suffering a near-fatal asthma attack in the summer of 2014, 51-year-old Peter visited the emergency department 18 times and had 15 hospitalizations. This is just in 1 year, which amounted to $643,000 in hospital charges. So as Peter's story underscores, our coalition brings together many of our community resources. Right now, there is currently a $1.5 million line item in the budget to support ACOs. We've been doing all of this work without state funding at this point. So we ask that you maintain this $1.5 million line item in the budget. Thank you for your time today, and I'm happy to answer any questions. There's a fuller testimony in here as well.
And I think it will remain, it's in the budget now, and I think it will remain there as we're going to try to negotiate a budget this year, so you should be okay.
Okay, wonderful. Thank you very much.
Thanks, Natasha. Felicia Johnson and Alderice Frazier. Come on up, folks. They will be followed by John Staub, Worker Environmental Council. I understand Michael Piper's here. Mike, okay, you're up. Very good. You're followed, Mr. Staub. And then they'll be followed by a panel. Is Andrea Katz here? Andrea Williams-Spiro? Oh, Lori's there. You guys are going to come up together, right? Okay.
Good afternoon, Chairman Scarlo, and thank you for the budget budget team for allowing us to testify today. My name is Alderice Frazier. I'm here with Felicia Johnson. We're parents coming from the city of Newark, New Jersey, and we're coming to speak about the budget line for charter schools. My children are 3-year-old Janiyah and Alderice Frazier and Deshawn. All three of them go to charter schools in the city of New Jersey. Of Newark, in the state of New Jersey. The charter schools are a public school, and as a proud parent of here, we like to talk about how my family experience at Thrive Academy and North Star Academy has been thorough for our parenting and for our community. My first daughter, Janiyah, was at a district school, and she struggled to provide the necessary quality education at the school. We desired a quality education, and at that district school wasn't available. So in 2004, we visited North Star Academy, and we found a better fit for our family. Janiyah has now gone on to college, and my twin boys are now in Kip, New Jersey's Thrive Academy. Thrive Academy, where I am the vice president of the parent partnership, and working with the staff and parents and also the scholars to have a community school where our children and community can work together. It is important to note that the staff at Thrive Academy has worked with parents and with myself to be able to give support in various different directions, from working with us at nighttime with homework and the weekends on their day off, working with making sure the homework and different assignments are definitely thoroughly prepared for the next day in school. I have received text messages daily from staff members at the Thrive Academy school. And I do need to say that my children came into Thrive Academy as kindergartners and were struggling behaviorally and somewhat academically. And now as second graders, they have moved thoroughly throughout Thrive Academy and received a much more proficient education and direction in their behavior and attitude. I see that, charter schools are also being able to be a breakthrough in our community, which I'm personally receiving, and also working with other parents such as Ms. Johnson, seeing that increase in the changing of our schools. Lastly, before I share, I want to just ask, please, that note that the charter schools have raised the bar for what is possible for schools in our community and for education. And to continue the support from this budget is important to us. And we definitely would ask you guys, ask the panel to allow the Governor Christie's budget plan funding for charter schools can be held steady and keep the funding for charter schools as proposed in this budget intact.
Ms. Johnson?
First, I wanted to say thank you. Is this on?
You actually, sorry, you should, no, just shut, there we go. One off, one on. There we go. Ms. Johnson.
Oh, okay. First, I wanted to just say thank you because you said my name right when you first said it. Most people don't say it right.
I try. I do my best.
So thank you for that. And thank you all for allowing us to come here and speak this morning. And first, I would just like to say, as a consumer, I constantly search for the best quality and products that will satisfy the needs, whether it satisfy my needs, whether it's on groceries, electronics, or clothes. If I can't find satisfaction in local shops or markets, I tend to research until I satisfy my desire or my finances. However, when it came to the education of my children, I understood quickly that what was being offered by their traditional schools was outdated and inadequate quality. I then discovered that I had a choice, a parental choice, and the superior product is what led me to North Star Academy. This is not to diminish the quality of public education, because without question, there are some exceptional traditional public schools right here in the city of Newark. North Star is an outstanding public charter school that Tyler was unfortunate enough to have been selected through the lottery back in 2007. My other son, Taylor, joined him in 2009. My son, Tyler, loves being a part of the geographic club and the basketball team, and my son, Taylor, is into the chess club and as well as Women's Circle Drum Squad. They both are also a part of Pop Warner Central Ward Blue Devils football team. My son is Made Mentoring Program in Veterans of America Post 1094. Attending North Star has given Tyler and Taylor time management skills that have helped them to excel in school as well as all their extra after-school activities. It's been an experience at North Star. Their innovative teaching methods and their strict level of accountability, not only for the scholars, but as well as for the parents, has produced great results, not only for my sons Tyler and Taylor, but also all the scholars that attend. The teachers there are educationally driven, as the campuses are structured to foster a close partnership between parents and scholars. North Star is something different. The teachers tend to dig a little deeper. Whether it was Ms. Hinton sitting on the floor of the hallway with Taylor to help him prepare for his final performance task last school year, or when I thought North Star was too much, not only for Tyler, but for me as a parent, but was encouraged to stay by Ms. Jackson. She would not take no for an answer. Other alumni and parents had similar experiences at North Star. I am forever grateful for them influencing me to stay. When I read text messages of how well my sons are performing, or that text of how well the day was totally off task for Taylor, I value that, and I welcome that communication I had with the teachers at North Star. The education that my sons are receiving is far more than what I can imagine. Taylor's middle school experience has been more challenging than I would have experienced with Tyler, but the teachers have been so supportive in keeping him on track and giving me the tools to help him do so at home. Tyler has already obtained a scholarship of excellence from the VFW of America last year in an amount of $6,000 for an essay that he wrote, and I credit that to the curriculum that he has been receiving that has helped him create that essay. Tyler will be a part of the first graduating class to complete K through 8th grade this upcoming June. Something that I'm very proud of, not only for Tyler, but for all the entire graduating class, and for me as a parent and all the other parents as well. I am so grateful for North Star and to have had the choice to find a great charter school option for my kids. I know many other parents who feel the same way that I feel, and Tyler and Taylor are on the road to success with not only the nurturing that they receive from home, but as well from the school focusing on the core values, which are courage, responsibility, justice, and caring. With these tools in hand, the sky is the limit for my children. And I say all of this to say that charter schools are performing, and I fully believe that you guys keep the budget the same way that it is, and be fair across the board with the charter school budget. And I like charter schools. Thank you.
Let me just say this to the two proud parents, because both of you talked a lot about your children, and that's great. It's great to hear that, and I'm sure you're so proud of them, and we're proud of them too. We were just talking about this, how Senator Bucco and I about charter schools, and I can remember years ago how I was always questioning them, and now you see the success, especially in the inner cities, and the success in Newark and Camden, and what they're doing for so many kids, giving them a different path and a different opportunity, and for your children to be excelling and grades K through 8 is a great story. It's a great success story. I think more and more people that come forward and talk about it, future governors, future legislatures will continue to fund charter schools as a successful alternative public school option. So it's important you advocate. So thank you for coming down.
And I'd also like to add too, I had my stepson, he graduated from North Star as well, and he's in his third year at Morehouse College on a full scholarship.
Make sure the second one gets a scholarship too.
Oh yeah, we already know that. Thank you.
Good afternoon. My name is John Stepp. I'm not affiliated with WEC. I collaborate with them. I'm actually, I guess, I'm speaking as a individual. Good afternoon, Chairman Sarlo, members of the Budget and Appropriation Committee. I am and have been a school building maintenance employee for the past 25 years in the Pine Hill School District in Camden County. I'm here today to speak about the need to fund our schools appropriately. As a building maintenance employee, I am given a responsibility that I take very seriously. My number one focus is to keep the learning environment safe and comfortable for our children so that they get the most out of their educational programs. I am deeply saddened and concerned when I see the decisions made in Trenton regarding school funding trickle down to the point where districts are forced to lower the expectations of what a clean and safe learning environment is. When a district is faced with either cutting programs or cutting operational costs, you really give them no choice but to slash the operational cost. The first thing that occurs is replacing products used with cheaper and less effective and less safe products. Next, the inventory of the maintenance products is cut to the point where instead of being proactive when addressing concerns, districts are forced to being reactive. Repairs are left waiting for funds or parts on order. The final blow is at the point when the district resorts to having to cut custodial maintenance staff. Once you start to lose these people, you not only lose the manpower, but you lose the knowledge of the buildings. The foundation of future repairs, upgrades, and daily operations is then put to risk because the resource and knowledge base is no longer available to assist in the decision-making and smart spending options. Like most change, this impact is not instant. It is instead a slow and quiet process, meaning the inhabitants of the buildings, our children, become used to the substandard environment. Are we okay with that? I'm a person with the boots on the ground, and I see this happening right in front of my eyes, so anyone interested in convincing me this is not happening is wasting their time. This is an issue in any district, more so in districts with less access to funding. I'm asking you, the leaders of our great state, to empower me and my working peers to do what we are paid to do, to give back to our children the opportunity to have a safe, clean, and healthy learning environment so that our institutions can propel our children to the highest level possible in adulthood. Winston Churchill said, "We shape our buildings, thereafter they shape us. Let us not allow our children to be shaped by substandard expectations. Please fund our schools." Thank you.
Thank you, sir. Okay, Andrea, Katz, and Lori Thayer to come on together. Oh, all right, that's okay. Come on up. John, you next. I'm sorry, I jumped ahead of you.
I'm sorry. Should we okay? Do you want him to come up?
Oh, Mike Piper, I'm sorry. Let Mike come up, I'm sorry. Mike, come on up. I apologize, everybody. Then Andrea and Lori. Sorry about that, sir. Is Bill Spiro here? No? Is Sarah Lilia here? Okay, Sarah, you'll follow. And then Daniel Lombardo? Okay, and Joseph Jones, Superintendent. Okay. Yes, sir.
Chairman Sarlo and the rest of the committee, thank you for having me today. I say here today as a father first and a taxpayer second. While I will be addressing specifically the Delran School District, which my children attend in Burlington County, we are not the only people and the only district in this situation. However, the biggest fiscal challenge our district faces is an external one that has been developing and worsening since 2008-2009 school year. The state of New Jersey has, in violation of its own law, underfunded our district by $11 million annually for the past 7 years. In 2008, the New Jersey legislature approved the School Funding Reform Act, a law designed to ensure that all public school districts would receive the funds necessary to provide their students with an adequate education. The SFRA funding model takes into consideration local tax levies and individual student demographic information that affects per pupil costs, and district aid is calculated and distributed accordingly. In short, the funding model enacted when the SFRA became law is so effective that it is a model for other states. However, the state of New Jersey has categorically failed to fund districts according to the SFRA, to the detriment of students, taxpayers, educational programs all over the state. Since shortly after the 2008 legislation became law, thus far the state has only funded the formula 85% of what would be considered adequate in 2009. And for fiscal year 2016-17, our district spending plan is $4.1 million below the amount deemed adequate by the Department of Education. The first major financial blow to Delran came in 2010 when Governor Christie froze state aid to all New Jersey school districts and required districts to use or surrender their surpluses to the state's general fund to make up for a budget shortfall. At that time, the Delran Public School District had a surplus of approximately $3.2 million, roughly $2 million of which had come directly from local tax revenue and was earmarked for local education spending. In essence, Delran, along with other districts that were in similar situations, was punished for fiscal responsibility. In June of the same year, Delran state aid was reduced by $1.9 million, which combined with the aid freeze and surplus liquidation resulted in a funding loss to the district of over $5 million in a period of 6 months. Further exasperating Delran's funding issues is the fact that our district does not receive adjustment aid support that was originally intended to hold harmless districts that saw aid reductions as a result of the new formula. In accordance with the stipulations set forth by the legislature that approved the funding formula, qualifying districts would receive adjustment aid, the amount of which would decrease steadily over a period of 5 years and then be eliminated altogether until their budgets were equalized under the new formula. However, because the formula has not been funded since the FRA was signed into law and since state has remained flat for years, districts that were scheduled to be weaned off adjustment aid continue to receive it, sometimes to the tune of tens of millions of dollars per year, while districts like Delran, which never received adjustment aid, continue to struggle financially. Put simply, the state's failure to fund the SFRA formula, coupled with the state's failure to wean comparatively overfunded districts off of adjustment aid and redistribute those funds to chronically underfunded districts like Delran, will continue to directly and negatively affect the children's families and taxpayers in our town. These problems must be addressed and remediated as soon as possible, or our children will suffer the consequences of chronic underfunding, and our taxpayers will be tasked with compensating for the state's funding failures. Thank you.
Sir, bring something.
Lori and Andrea, would you come up, please? Thanks.
Thank you.
Thank you. I'd like to thank the chairman and the committee for your time today. I'm actually going to be speaking a little bit about the same things the gentleman previously just spoke about. I am first and foremost a mom of 3 kids in the Chesterfield Elementary School District. I also have the distinct honor and privilege of serving on the Chesterfield Township Board of Education. We are a very small town. We have about 7,000 tax-paying residents. So when I talk to you about numbers here, it's a small school, it's a small town. And I'm here to explain what it means to be an under-adequacy district. Chesterfield's adequacy budget, according to the state, is just a little over $10 million, and our operating budget last year was just under $9 million. We are spending $1,310,914 under adequacy. The local fair share of taxes, as determined by the school funding formula, is a little over $7 million, and our tax levy last year was over $8 million. We're taxing our residents close to $1 million more than they can afford to pay, according to the state. And I'm sorry to Lori here, who's another mom in Chesterfield, but we're going to be raising their taxes again this year because we have to. In 2005, Chesterfield had 295 students, and that was pretty typical for the time. We've had a large building boom in Chesterfield, and we now anticipate close to 800 students next year. When a school has had significant enrollment increases, flat aid that we've been experiencing is like a cut in aid. Our growth has made our underfunding even more dramatic over the years. Chesterfield is the lowest spending district per pupil district in Burlington County, and we are paying the second highest taxes in the county. And this is because we were receiving such a low portion of aid. Last year, we received $437,000 in aid, and we should be getting $2,873,580. That's a lot of money that we're not getting. This year, we're getting an additional $16,000, and we're very grateful for any increase but when you're that underfunded, $16,000 is just a drop in the bucket. And it's easy to chalk these funding gaps up to the fact that there isn't a lot of money in the state, but that's not the problem here. There are many districts throughout the state that are getting more money than they should. Out of 578 districts in the state, 196 districts are receiving more than 100% of their funding. The state funding formula is funded currently at around 85%, and there are 259 schools that are receiving more than that 85%. I'm in the 12th legislative district, and I've looked at 2 different districts in our legislative district that are getting significantly more money, and the Manalapan Englishtown district has been able to decrease their taxes. They're getting $12 million more than they should. The Jackson School District is getting $10 million more than they should, and they're able to allocate $19 million to purchase smart boards. When in Chesterfield, we're pinching pennies and making difficult financial decisions that, quite frankly, I don't think we should have to make, and if we wouldn't have to make if we were fairly funded. And I'm not asking for anything more than what the state has determined to be our share. And I actually came up with a list, and I could read each of you have districts in your districts that are underfunded.
Would you be able to give that out to us, since it looks like you're at the end there? We'd love to see it, I'm sure.
Absolutely.
Should I greet time? May I, just because I have to step out for a moment, and this actually addresses both your concerns and Mr. Piper's concerns, who spoke just previously. We hear you loud and clear on this adequacy, and Senator Beck has been one, Senator Sweeney, working on a proposal. I think, just be patient. I think a lot of you will be pleasantly surprised on what the Senate is working on, dealing with those who are very over adequate and those who are under adequate, sometimes in neighboring communities.
Yes.
I know we heard about Delran Town, and your Chesterfield, and assuming in that school district. So we hear you loud and clear. Senators on both sides of this aisle, Republicans and Democrats, are working on a plan, and I think you're going to hear something sooner than later. So we hear you loud and clear. Be patient.
Thank you, and I know Assemblyman Dancer, I've been in contact with him, and he has an appropriation bill that he just sponsored yesterday that would at least give a little bit money to help us when you're under adequacy for so many years. It's a huge challenge. Thank you, I appreciate your efforts. Thank you. Thank you. Thank you.
Thank you very much. Okay, the next person is Sarah Lilia, Director, Lutheran Episcopal Advocacy Ministry, New Jersey.
Good afternoon. Thank you very much for holding these hearings and allowing me an opportunity to speak. I'd like to begin actually by talking a little bit about who we are. We represent the Lutherans and the Episcopalians in the state of New Jersey, and supported by the 3 dioceses and a bunch of bishops. But I guess I want to begin by saying that our faith really does guide us in our understanding of the world we live in, and it aids in our decision making. It inspires us to work for justice. So there are several issues that we would like to address your attention to today, particularly around the issues that focus, we can cluster around the issues of poverty. And we're very concerned because of the widening gap between those who are struggling to make ends meet every month, who are paying extraordinary high rates for apartment rentals, and are continuing to struggle to find hourly work that can help them pay their bills each month. Housing seems to be one of the #1 drivers of poverty. We know that rents are so high in New Jersey, many people are paying over half of their monthly income for rent alone, and this is just simply not sustainable. We also know that funding homelessness prevention is much more effective than trying to help people once they become homeless. So these questions about how to remedy homelessness really starts with some basic preventative measures like state rental assistance programs that haven't had any new funding in many years, and also assistance so that people can continue to stay in their homes with perhaps additional support for food through SNAP benefits and other assistance opportunities. We're really concerned about Work First New Jersey. It's an important program because Work First New Jersey and TANF benefits aid the extremely poor. These aren't people who are working for hourly wages, but these are people who are often unemployed or on and off because of mental illnesses, medical illnesses, or other issues. So that when we talk about poverty alleviation in our state, we need to be clear that one size doesn't fit all, that one program won't address all of the needs of those in New Jersey who are struggling and who are working hard. TANF is a program that hasn't been increased in 29 years and is desperately in need of support. We have lots of churches who continue to provide assistance for needy families, and they are struggling because they haven't received any increases in their support as well. Also, we talked a lot about the earned income tax credit. That's been increased, but there's still a need to increase that assistance for people who are working because they invest that money right back in the community. So there's all kinds of resources and support to help people who are struggling, and we'd like to encourage the state to think about and prioritize the needs of the poor because there's such a struggle and such an incredible gap here in our state. It's immoral, it's just simply something that shouldn't be tolerated. And we also know that New Jersey is one of the wealthiest states in the nation, so when you get this incredible gap, it becomes just a problem we can't live with, and we certainly need to encourage you all to do what you can to help care for all the residents. Thanks.
Thank you. And you know, the legislature is working on these issues right now.
Absolutely.
So hope we make
Can't miss the opportunity to thank you for that work and to
thank you for your work as
thank
well. Daniel Lombardo, President and CEO, Volunteers of America, Delaware Valley.
Madam Chair, members of the committee, thank you for allowing us to testify today. As you heard, I am the CEO of Volunteers of America Delaware Valley. We're an organization that's been around since 1896. We provide services to some of the most disadvantaged people in our society, and we are here and delighted to have you here in South Jersey. Not too very far from you here in Senator Sweeney's district, we have a family shelter which is literally 5 minutes away from here, and we also have a 60-unit affordable senior housing project not too very far from here. So welcome to South Jersey, and I hope you're enjoying your stay here. I come to you to talk to you about something that you did for us last year, and I'm back at you again to ask you if you wouldn't mind doing it again for us this year. As you know, New Jersey has the very unique distinction of leading the country in reducing its prison population. New Jersey has reduced its prison population by 31% over the last decade. And as a result of creative policies and procedures that you, as an august body, have enacted and changed, not only sentencing policy, but options that are available for treatment of offenders. Well, there's something that you gave us last year. You gave us a direct appropriation to provide services to folks returning to society coming from county jails, as well as those that have maxed out of prison. As you know, those are the populations that have the highest chance of reoffending in the community. You gave us a $1.5 million appropriation to provide services in both Trenton and Atlantic City. When we looked at the governor's budget this year, we were told that if we reached certain benchmarks, we were told if we could serve 200 people in this coming year, since the grant started in November, we would have 2 more years of funding. Well, so far, you need to know today we've served over 450 people. By the time that the grant expires, we'll serve 600. So we'd like you to reconsider adding that an additional $1.5 million to allow us to continue our work in Trenton and Atlantic City. We would also like to expand our services to the city of Camden, and we'd also like to do it in the jail, a combination jail between Gloucester and Cumberland County, and that would be an additional $1.5 million. Also, you're going to probably be hearing from a lot of folks that now that the new bail program is in place, that there's going to be services that are going to be necessary for folks that are now being eligible for the new bail project. You're going to see folks that are homeless, folks that have chronic mental illness, folks that have addiction issues that will need some services and programs. And that's also going to be something that you're going to be asked to supplement, also asked for additional appropriations for. Now, everything that I've told you is much more clearer and a lot more in detail in the presentation that I left behind, but I'll be willing to answer any questions you might have.
I know we want to thank you for your good work, and I'm sure your request will be taken into consideration. And we appreciate the specificity of it.
Thank you. Thank you very much.
Okay, thank you very much. And Joseph Jones, Superintendent, Woodbury City Public Schools.
Good afternoon. I'm just as proud of the Woodbury schools as the family that was up here talking about their charter school. We are a small pre-K to 12 school district. The district serves a student population that is 66% qualifying for the free and reduced lunch program. So 2 out of 3 of our students fit into that category. And yet, at the same time, we lead our county in terms of the number of graduates who come out scoring a 3 or better on their advanced placement test. It's really remarkable work that our teachers do. But one of the struggles is exactly what some of the people who have stepped up here right before me talked about, the SFRA funding formula. They said it perfectly. I'm glad to hear that they know it. I'm just hopeful that you know it as well as they're saying. My community is 70% funded on SFRA. SFRA was funded for this current school year at 85%, according to the state, across the state. Surrounding me is a community that wraps right around Woodbury at 90% funded SFRA formula. It's a really tough situation when in Gloucester County itself, just in our small county, one school district will get $14 million above 100% SFRA, while we're at the 70% threshold. And it makes the job very difficult. One thing that I did hand in for you in my packet is something that a colleague of mine, he and I have been kind of trumpeting the idea, well, how do you start to address this issue? Underfunding is difficult for sure. The inequitable aspect of it is the tough part. Where do you start? There are districts that are like the ones that were up here right before me, funded at a point where they can't reach adequacy, and yet they're over 100% in terms of their local fair share. Woodbury is one of those districts. So there's 70 in the state. I've got a chart on my website. It's interactive. You can click on your legislative district and see how many are in your legislative district. 29 of the legislative districts have the 70 schools that are under adequacy and over 100% in terms of their local fair share of their taxes to their residents. They really can't do anything more. They can't make up that difference. It's impossible for the local community to do any more than they're already doing, and yet there's no way for us to get up to adequacy. So those 70 districts identified by what he's calling, my colleague, a funding fairness index, are there in my report for you so that you can see. And like I said, you can go onto our website at Woodbury and see your individual legislative district. It's graphical, you'll be able to, it's interactive. And then the second piece of what I want to talk to you about is make sure that it's kind of tangential to the budget itself, but it's important. The legislative last time you received the adequacy report, you rejected the new weights. Once again, new weights are part of this funding formula for schools where unilaterally the governor's office has reduced what the weight for at-risk students will be. Last time the legislature turned those new weights away, and I'm hopeful that you'll be able to support that as well because it's hurtful to the funding scenario for schools like ours. Thank you so much.
Thank you. Thank you very much. Any questions? Okay. Thank you. I have one more here. Megan Tinsley, I believe from Audubon. Are you here? Okay, thanks. Is there anybody else here to speak? If so, raise your hand. Okay, thank you.
Thank you, Senator, and members of the Budget Committee. I'm Megan Tinsley, Policy Director for New Jersey Audubon, and I appreciate the opportunity to provide comments. As you probably know, New Jersey Audubon is a privately supported, not-for-profit, statewide membership organization. We're founded in 1897, one of the oldest independent Audubon societies, and we have approximately 20,000 members and 50 full-time staff in the state. And we are also coordinators of the New Jersey Keep It Green Coalition, which is comprised of 185 member organizations, which work to support the passage of the ballot measure to dedicate funds for open space in November 2014. We are cognizant of the limited funds in the state for many, many different needs, as you've heard today, such as the Transportation Trust Fund, pensions, education, and local aid. However, because our environment is so critically linked to protecting our growing economy, we absolutely consider it a top priority, and we hope that you will as well. Our future, the health of our citizens, and quality of life depend on clean water, locally grown foods, tourism, and access to parks. As you know, and I mentioned, in November 2014, voters of the state overwhelmingly supported permanently dedicating a portion of the corporate business tax toward open space preservation and stewardship. And it's vital that we ensure that these funds are protected and used as the voters intended. In the past, funds which were supposed to provide for new projects and support on-the-ground efforts, or which were intended to have been granted to county and local programs, have been used to supplant existing financial obligations of the state for paying for things such as existing staff salaries and by funding maintenance projects. And budgets and staff support from the general fund have continued to be reduced. Unfortunately, this year's budget appears to do the same. The governor's budget demonstrates why passing and implementing legislation to allocate funds under the corporate business tax is so vitally important to ensure that funds are not diverted to inappropriate uses, such as funding routine operations and maintenance. We are particularly concerned about the proposed use of $19.972 million in the voter-approved CBT funds dedicated to preservation and stewardship, which will instead be used to support state park management and staffing, approximately 307 state park staff positions. And while we, as New Jersey Audubon, agree probably more than anyone that state park staffing is vitally important, we don't believe that it should come from these dedicated CBT funds, as stewardship is not defined as routine operations and maintenance. Instead, we believe that these should be funded through the general fund, as they have been in the past. And and then dividing the funds through the yearly appropriations process does not provide the transparency, predictability, and reliability that's needed to guide the strategic investment of the state. So implementing legislation is required, and we appreciate the Senate's passage of such legislation yesterday, and we will of course call on the Assembly to do the same. And while we appreciate that efforts have been made to minimize cuts overall in the DEP, and we recognize the dire fiscal situation of the state, previous cuts have been disproportionately placed on our environment, and they continue to greatly impact the ability of the department to do its vital work. The overall DEP budget is once again reduced this year approximately by 2.1%. Additionally, for over a decade, the DEP has seen substantial cuts in staffing, going from 4,000 employees to approximately 2,800. So we believe that we should be gradually restoring staffing to previous levels in order to adequately protect the state's land, air, water, and public health.
Excuse me,
Yes.
to wrap up?
Oh, sorry, I had timed it for 5 minutes and I forgot.
Oh, I'm sorry.
I forgot that you said 3. So I'll skip that part and just say, we believe that we must continue to invest in our natural capital. If we do not adequately provide for this investment, the state will experience not only decline in our natural resources and the benefits that they provide to residents, but also significant loss in revenue in the coming years, because we know that the environment and our access to parks and things like that do drive decisions when businesses decide to locate to New Jersey. So thank you for your time.
Okay, thank you. Meeting adjourned.